Order.
Thank you for giving me the honor to do the opening prayer. I give you thanks. As you sit here to represent the Northwest Territories, work well together. When we listen to each other and work well together, things will fall into place. I will now say a prayer for you in the language.
Please be seated. Colleagues, before we get going, I'd like to welcome the students from NJ McPherson, the grade 5 class. So we're going to be on our best behaviors, correct, colleagues, for our amazing students. So welcome to our assembly. Minister statements. Minister for ECE, or ECC, sorry. I'll just stress her out.
Thank you, Mr. Speaker. Mr. Speaker, the Territory's 2025 wildfire season was a challenging one, with 201 wildfires and nearly 1.4 million hectares burned. This was one of the most active wildfire seasons in Northwest Territories history. I want to acknowledge the tireless dedication, personal sacrifice, and incredible teamwork of our staff. Wildfire crews showed up day after day to protect our territory. These efforts deserve the recognition and appreciation of this House. Fire seasons in the NWT used to last 8 to 10 weeks each summer, but with climate change in recent years, we have seen crews and fire personnel actively responding to fires for 5 straight months, from May to October. Mr. Speaker, this season marked a 4th year in a row with prolonged drought conditions, creating extreme fire behavior, causing some fires to burn nearly a meter underground. Our air crews, ground personnel, and support teams brought under control, or put out more than 100 fires this year. And most importantly, no one was hurt and no homes were lost in our communities, thanks to the hard work of the wildfire responders. Carefully planned ignition operations in communities like Gamity, Wati, and Fort Providence successfully stopped wildfire spread. Mr. Speaker, after the 2023 wildfire season, the government made changes to improve how we fight fires based on the recommendations from the operational review. In response to that review, we began using new fire behavior tools to provide timely, accurate forecasts and to support safer, more effective wildfire operations across the territory. We are continuing to send more staff to complete advanced fire behavior training, which will strengthen our forecasting and modeling capacity to meet the challenges ahead. Mr. Speaker, building wildland-urban interface, or WUI, preparedness was also a key theme of last year's review, and this year we saw those investments pay off. We launched new basic WUI response training for smaller fire departments to increase capacity with sprinkler setup and structural triage. We also developed interim deployment guidelines for municipal fire departments supporting wildfire events. In Wauhee and Fort Providence, local fire departments put this training into action, working side by side with wildfire professionals to successfully defend their communities. In the communities of Fort Smith, Hay River, and Fort Simpson, used resources to support wildfire response, applying lesson learned from past wildfire experience, and through GNWT training to help residents in neighboring communities. Structural protection trailers supported efforts in Wrigley, Fort Liard, Jean Marie River, and areas along the Liard Highway. 2 new trailers added this year have the capacity to protect nearly 200 homes and buildings across the NWT. Mr. Speaker, these improvements will be the foundation of a more resilient wildfire program in the years ahead. The 2025 season was shorter and less severe than 2023, but it was not without hardship. As the Premier has said, residents came together to support one another through these challenges. Mr. Speaker, this has been a difficult wildfire year across the country. While the severity of next year's season is uncertain, the GNWT remains focused on investing in readiness and resilience to help ensure our communities are safe. Thank you, Mr. Speaker.
Minister ECC. Minister statements. Minister of Municipal and Community Affairs.
Mr. Speaker, the 2025 emergency season once again tested the strength and resilience of our territory. It showed the courage and dedication of those who step forward in times of crisis to protect residents and communities. It also reinforced that the changes and improvements we have made since 2023 are making a real difference in how we respond and recover. I want to begin by recognizing and thanking everyone who worked in the front lines over this past emergency season. Our wildfire crews, community firefighters, and first responders often put themselves in situations where they're at great risk working to contain and suppress fires threatening communities. Their skills and determination helped keep people safe, slowed advancing wildfires, and gave residents time to evacuate safely. This year again, several communities face significant challenges. Jean Marie River faced multiple evacuation alerts, and residents in Wauhee and Fort Providence had to leave their homes in order to ensure their safety. The task of hosting evacuated communities is a complex responsibility. Hay River, Betchico, and Yellowknife stepped up to host and care for these evacuees. In collaboration of leadership, including Indigenous and community governments, non-government organizations, volunteers, local businesses, and supporting evacuees was impressive and inspiring. Mr. Speaker, I want to thank the United Way and the Salvation Army and all the other local local emergency management organizations, their staff and volunteers for once again stepping up to help. These organizations are instrumental in assuring that where urgent responses are needed. I also thank all the residents who demonstrate compassion, resilience in helping the evacuees during this challenging time. You are the example of what we mean when we say better together, Mr. Speaker, since the 2023 Emergency Response After Action Review, the Government of Northwest Territories had made measurable progress. The After Action Review process provided clear direction on how to provide improved coordination, strengthen communication, and better support communities before and during and after emergencies. Of the 35 recommendations, only one was disagreed with. The Government of Northwest Territories has established an integrated emergency management system that is both flexible and responsive. This system now includes improved guidance and accountability, regional emergency coordinators, and strengthened capacity and strategic support. These recommendations have many actions already underway. We have implemented new processes for information sharing between departments and communities, enhanced training for staff and partners, clarifying the roles and responsibilities for all levels of government and agencies. Committed to the review of the Emergency Management Act, in partnership with the Indigenous and community governments, increased our surge capacity to support large-scale response. The GNWT has also expanded use of the incident command system to ensure consistent, coordinated across all levels of governments. While the Government of Northwest Territories will not create a standalone emergency management agency, we will commit to enhancing our training, protocols, and government structures. A standalone agency is not feasible for the NWT given this NWT's small population, limited fiscal and human resources, and the infrequency of large-scale emergencies requiring sustained level response, territorial response. A separate agency would be costly, duplicative, and difficult to staff. Looking ahead, we know the emergencies will continue to challenge our territory. Climate change is making wildfire seasons longer, more intense, and we must be ready. Of the lessons this government has learned, perhaps one of the most important is this: to respond effectively and efficiently to the unique needs of all our communities. Big or small, emergency response in the North cannot be a one-size-fits-all. The Government of Northwest Territories continues to create opportunities for engagement and collaboration with local leadership, who know their communities best. Our focus remains on building stronger partnerships, improving communication, and ensuring that residents feel supported and confident when emergencies occur. A key part to this work is supporting community governments in developing and testing their community emergency plans. The work continues to strengthen community preparedness through workshops, tabletop exercises, so that everyone is ready for emergencies when crises arise. The Government of Northwest Territories will continue to invest in surge capacity training, including incident command system training, to ensure a robust foundation of support. In addition, we continue to work with our partners through exercises like Operation Nanook, which allows us to test our systems in a real-world scenario and improve coordination across all levels of government. By taking these steps, we are building an emergency management system that is stronger, more inclusive, and better prepared for the challenges ahead. Mr. Speaker, the people of the Northwest Territories have once again shown their resilience, resourcefulness, and caring. Since 2021, we have faced 5 consecutive years of major emergency events, 3 of which resulted in disasters and affected thousands of residents and businesses that caused significant damage to our communities. The progress we have made through the Be Ready campaign in planning and preparedness is paying off. We have come a long way to strengthen our emergency management system. We have collectively involved across all phases: planning, preparedness, and response. There have been improvements on how wildfires are fought, and we support these with enhanced approaches with the Wildland-Urban Interface Structure Protection firefighting. While we know that there is always more to learn, it is important to recognize how far we've come. The lessons of the past 5 years strengthen our collective knowledge, and we continue to improve how we will respond in emergencies. The GNWT will continue to stand with communities before, during, and after emergencies, ensuring we are building on what we have learned to be stronger in the future. Thank you, Mr. Speaker.
Thank you, Minister of Municipal and Community Affairs. Minister statements. Minister for Health and Social Services.
Mr. Speaker, ensuring residents across the Northwest Territories continue to have access to health care that is safe, reliable, and equitable is a top priority for me and for this government and for the Northwest Territories Health and Social Service system. Today, I'm pleased to share an update about the work that we are doing within that system to improve care in small community health centres and health cabins. Just like every jurisdiction in Canada, our health care system is strained by staffing shortages. As a country, we simply are not graduating enough doctors, nurses, and allied health professionals to meet the demand. This has contributed to the most competitive recruitment environment we have ever seen, in the Northwest Territories. That pressure is compounded by the challenge of recruiting and retaining staff to work in the many small and remote communities across our territories. The department is working closely with the Health and Social Services Authority to lessen the impact of ongoing staffing shortages, make service delivery more efficient, and protect equitable access to care across the territory while we recruit to fill vacancies. Our work is focused on making care in small communities more sustainable, adopting smarter practices and new technologies to improve efficiency, and getting results. Getting the right mix of health professionals in our health centers and health cabins, and above all, ensuring every resident has equitable access to care no matter where they live. This work focuses on finding more sustainable ways to deliver healthcare service in small communities, identifying methods, practices, or technologies that make those services more efficient and effective, balancing the right mix of healthcare professionals in health centers and health cabins, and ensuring that everyone has equitable access to care regardless of where they live. To support this work, we've established a working group with members from all three health authorities, Health and Social Services authorities, and to date this group has reviewed and assessed the current state of the system, performed a gap analysis to identify areas needing improvement, gathered input from frontline staff to explore new approaches and evaluate promising practices. Conducted a jurisdictional scan that included targeted engagement with similar jurisdiction and with Indigenous Service Canada. Mr. Speaker, this work resulted in 5 recommendations, each intended to support and strengthen the existing community health-led, nurse-led model of care rather than replace it, by making it better, more integrated use of other care providers, and building on more consistent and resilient delivery systems and care. The first 2 recommendations focus on how licensed practical nurses and paramedics can become part of the care model in the small communities. This review will include a comprehensive examination of how they currently are used, funded, trained, supported within the system. The third recommendation involves identifying programs and services that licensed practical nurses and paramedics can immediately support, and whether additional training can safely expand their roles and enhance service delivery. Fourth, the Department of Health and Social Services is creating new standards to oversee the administrative functions of health centers and health cabins. This will ensure compliance with legislative requirements and support consistent care across communities, while including ways to monitor and track progress. The final recommendation is to continue to recruit and, importantly, to retain community health nurses by identifying, implementing, and supporting fatigue reduction strategies. Mr. Speaker, the department and the 3 health authorities have developed a work plan to act on these recommendations. Improving the model of care takes time and requires careful planning. It is essential that any solution we provide are flexible, adaptable, above all, sustainable. While this work is not formally a part of primary care healthcare reform, it is closely aligned. Together, these initiatives will improve access to healthcare across the Northwest Territories, ensuring Northerners receive consistent, high-quality health and social services. Mr. Speaker, before I conclude, I want to take the moment to sincerely acknowledge and thank our dedicated frontline staff. Their commitment, resilience, and compassion are the foundation of our health and social service system. Every day they rise to the challenge, often in difficult and demanding circumstances, to provide essential care to residents across the Northwest Territories. This work is not only about improving the system, it's about supporting the people who make it work. By strengthening the model of care, we are also ensuring that our frontline teams have the tools, resources, and support they need to continue delivering high-quality care to every community. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Member statements. Member statements. Member from Mophie.
Yes, thank you, Mr. Speaker. Mr. Speaker, this past summer, our communities faced another period of unprecedented threat from wildfires, resulting in multiple evacuations that disrupted lives, strained resources, and highlighted the vulnerabilities in the GNWT wildfires management. In the span of 3 days this past summer, the communities of Wati and Fort Providence were forced to evacuate due to rapidly advancing wildfires. The fire was burning out of control in Gamity as well. It came close to their golf course. These evacuations are not isolated, Mr. Speaker. They are part of a growing pattern of climate-driven emergencies that demand a shift from reactive to proactive wildfire strategies. Since the mass evacuation of the 2023 wildfire season, I have heard countless times from many frustrated residents. Former NWT MLA and MP have said it as well, that when the federal government oversaw the forest fire program, they would extinguish the fire at the outset. Now that the territorial government is in charge, they let the land burn to let the fire burn itself out. And that action is only taken when a fire is near a community, as we have seen this past summer. Mr. Speaker, hearing this repeatedly tells me that the GNWT wildfire management program is failing. Climate change and its effect can no longer be ignored by government policy. Wildfires, regardless of their proximity to communities, must be fought at the earliest possible stage when they are small and manageable. I want to take this time to thank that supported the Wati and Fort Providence evacuees. Thank you for your generosity and kindness. I also want to thank our firefighters and community government workers for the work that they do in keeping our people and communities safe. They are to be commended. Mr. Speaker, as I have said before, my comments and frustration are not directed at them.
Member for Moultrie. Member for Moultrie, your time is up.
Can I have a consent to conclude my statement, please?
Thank you, Member for Moultrie. Member for Moultrie is asking unanimous consent to conclude her statement. Seeing none, Member for Moultrie.
Thank you, Mr. Speaker. Mr. Speaker, as I have said, they are to be commended, the workers. Mr. Speaker, my frustration and comments were not directed at them. It was towards the GNWT government policy that needs to change before a community is destroyed, as we have seen in Fire 2023, and people's lives are put in jeopardy. Thank you, Mr. Speaker.
Thank you, Member for Moultrie. Member statements. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, this week we continue our call for a red alert on the economy. Hear, hear. And for the primarily focused on the revitalization of our mining industry, starting with modernized regulations, expanded incentive programs, and an independent review of this sector's decline to drive the exploration needed to reignite the NWT economy. However, a world-class mining sector needs more than just incentives and policy changes. It also needs robust infrastructure. Recently, newly proposed projects are emerging to better connect the North with global markets. Chief among these is the proposed Arctic Security and Economic Corridor, a transformative initiative to link the mineral riches of the Slave Geological Province to a deep water port in Nunavut positioned along the historic Northwest Passage. This project would be a game changer for both territories, Mr. Speaker, and also for Canada. But at the other end of that corridor one end is the Nunavut port, at the other end is our airport here in Yellowknife, Mr. Speaker, which is a huge strategic resource for the territory. However, the task of scaling up YZF must move forward regardless of the proposed corridor. For an airport its size, YZF experiences an exceptional level of traffic, not only in support of mining operations, but also of our expanding tourism sector and essential transportation services to communities across the North. Mr. Speaker, Yellowknife is a destination city, and that airport is the gateway not only to Yellowknife, but to the whole Northwest Territories. Furthermore, as part of our commitment to NATO spending targets, airports are now recognized as strategic infrastructure central to our defense posture, opening the door for major investments in YZF from both NORAD and the Department of National Defense. When you consider the expansion of our armed forces, growing our mining industry, increasing our tourism and expanding our tourism product, and adding to the transportation needs across northern communities, the case for major investment in YZF becomes clear, as does its inclusion as a major project in our strategic priorities, well equal to Tulston, MVH, and ASEC. Nunavut has its strategic port at Grays Bay, and we have ours at Yellowknife Airport. If this expansion of YZF isn't treated as a strategic priority on its own right, then it must be integrated into a comprehensive plan for the Arctic Security and Economic Corridor. Thank you, Mr. Speaker.
Thank you, member from Range Lake. Member statements. Member from Yellowknife Centre.
Thank you, Mr. Speaker. Similar to my colleague, I want to speak about the economy. The Arctic Economic Security Corridor is a red alert, and it needs to be heard loud and clear.
Yes.
I doubt it would have even made the second-tier list of major projects if it wasn't for the West Kitikmeot Resources Group, Mr. Speaker, and I'm very thankful for their work. Currently, it's on the maybe list, but that's pretty good, Mr. Speaker, better than the not list. But if you look closely, it's being sold as a north to south list by the West Kitikmeot Group. The Arctic Security Corridor is sold as an all-weather road, land, and port to port to port, Mr. Speaker, infrastructure. It's going north to south, not south to north, Mr. Speaker. I would remind this would-have, should-have, could-have government, we need to seize the day now before the economy ceases to operate, Mr. Speaker.
Yes.
If this isn't a red alert, I don't know what is, Mr. Speaker. I'm hopeful, but I do worry that the hubris of what's happening now is just to assume that the government is just going to step in and solve our problems without bold action taken by us. So you can hire all the envoys of the world. We need collective action, and that includes regular members, Mr. Speaker. I'm sorry to remind the Premier. But as I look forward, Mr. Speaker, the overconfidence so far that has been fueling the 706 days of this current government, I'm not sure there's enough in the tank to fuel it the next 714 days. Mr. Speaker, there's some dark days ahead if we don't see some action. Mr. Speaker, again, this major project is important to the economy of the Northwest Territories. I could speak at lengths to the benefits it can create, but we've all heard of them repeatedly. But more importantly, I should not forget the sovereignty. You know, the call to invest in NOIDO funding is so critical. Why are we falling asleep on this opportunity? Call to action, Mr. Premier, step up with some bold vision, work with the Tlicho and the YKDFN to bring together an organization group that can build in partnership, Indigenous partnership, territorial partnership, and federal partnership, to have our road grow from south to north, Mr. Speaker. Again, bold action. Mr. Speaker, let us understand this. Hope will not feed the bellies of the North, Mr. Speaker. We need determination from this Premier. Ring that fire bell of red alert, Mr. Speaker, because if he doesn't ring it, there will be no economy to save. Mr. Speaker, thank you.
Thank you, member from Yellowknife Centre. Member from Yellowknife North.
Mr. Speaker, our primary healthcare system has the potential to get better over time. We have access to newer technologies, including around virtual care, more programs than ever to recruit and train local practitioners, and a team working to improve Indigenous patient experiences. So how is it possible that people's access to primary care in so many of our communities has gotten worse over the past 5 years? I am tired of the explanation that healthcare across Canada is struggling and that we're somehow powerless to stop this decline. Not long ago, if you called for a primary care appointment in Yellowknife, you had a chance of someone answering the phone. You had a chance of getting an appointment rather than being told the schedule is full and to call back in 2 weeks when the next round of locum schedules open up. You didn't have to line up outside at 7 a.m. in the cold with your crutches or your sick children, competing with all the other sick people as if you were in some kind of reality TV survival show. Remember in 2019, when expanded same-day access was launched, and you could go to a walk-in clinic during mornings and evenings. What happened to that? If you go to the Stanton emergency room now, You used to be able to get lab results while you were there. Now, lab samples are being sent down to Alberta, creating the need to book a follow-up primary care visit, which is nearly impossible in a system with a 3-month waiting list and no ability for patients to check their own lab results online. If you live in a small community, you at least have a better chance of someone answering the health center phone, but community health nurses struggle with little support. 5 years ago, there were pilot projects in Betchiko and Fort Good Hope, building on successes in the Beaufort Delta, where the community health nurses had a designated physician on call to support them 7 days a week, so they could get advice before someone's health problem got worse and became an emergency. These pilot projects received little support and lost traction. Despite available technologies, most community health nurses still don't have video conference ability when they're receiving real-time support from emergency physicians. So they're apparently expected to be holding a phone under their arm or something while training someone in an emergency. Mr. Speaker, I ask for unanimous consent for the last sentence of my statement. Thank you.
Thank you, member from Yellowknife North. Member from Yellowknife North is seeking unanimous consent to conclude her statement. Seeing none, please conclude your statement.
Mr. Speaker, we have done better, and we so obviously can do better in giving people across this territory the most basic access to care in all our communities. Thank you.
Thank you. Thank you, member from Yellowknife North. Member statements. Member from the Deitcho.
Thank you, Mr. Speaker. Mr. Speaker, I want to speak today on serious concerns about the timing of the evacuation of Fort Providence during the recent wildfire threat this past summer. On August 31st, Fort Providence announced an evacuation order with a wildfire less than 2 kilometers north of the community, 900 meters to be precise. This evacuation order came far too late, when the fire was already dangerously close to the community. This delay put residents at risk and created unnecessary panic and hardship. Mr. Speaker, the Department of Environment and Climate Change is responsible for wildfire detection, assessment, and operational response. It is the department that monitors fire behavior, models risks, and advises on evacuation timing. In the case of Fort Providence, the warning signs were there, yet the response lagged. This begs the question, why did it take so long for the evacuation to occur? Wildfires are becoming more aggressive and unpredictable. Climate change is accelerating these threats, and our communities are increasingly vulnerable. We need a broader safety margin, one that accounts for the speed and volatility of modern wildfires and the logistical realities of evacuating remote communities. Mr. Speaker, I'm calling on the Minister of Environment and Climate Change to review wildfire response protocols. We need earlier action, clear communication, and stronger safeguards. Better communication both internally within the GNWT and with community governments is a critical step towards ensuring that communities like Fort Providence are not left scrambling when danger is already at their doorstep. Our residents deserve better. They deserve a system that prioritizes safety and acts decisively. We need to learn from this experience and ensure that future wildfire responses are timely, proactive, and rooted in the realities of climate change. I'm going to ask for unanimous consent to conclude my statement, Mr. Speaker.
Thank you, member from the Deitcho. Member from the Deitcho is asking unanimous consent to conclude her statement. Seeing none, member from the Deitcho, you may conclude your statement.
Thank you, colleagues. And I too would like to thank the community of Hay River for hosting the evacuees in Fort Providence, the Catlo-Deitchi First Nations for help assisting take care of the elders, and all the firefighters that came from far and from in the territory during this wildfire season. Thank you, Mr. Speaker.
Thank you, member from the Deitcho. Member statements. Member from Great Slave.
Thank you, Mr. Speaker. On May 30th of this year, NTHSSA released a report that has yet to be discussed in this House. Today, I want to talk about this report entitled Honoring the Voices of Indigenous Peoples. It is the product of 2 years of collaborative work of the Cultural Safety Design Collective, with representation from NTHSSA, Indigenous patient advocates, Hay River AHSSA, Cleachon Service Community Services Agency, and HSS. The scope started with a review of Stanton's Indigenous Wellness Program, but while listening to the lived experience of Indigenous folks, this scope grew to receive insights across the entire NWT health system. This report sets out 13 crucial actions for change to improve healthcare outcomes for Indigenous residents. It shares the voices and experiences of Indigenous patients and advocates and lays bare the system supports for Indigenous patients are under-resourced at best and at worst that the system is blatantly racist. I want to commend everyone who worked on this report, and I urge all residents to read it. It is the first government report I have ever read that not only calls the lack of adequate educational and training supports for Indigenous patient liaison staff preposterous, it is also brave and unflinching in how it describes racism and white supremacy baked into the health system, and insists that government must expedite work on the actions for change, citing the responsibility of leadership to address long-standing systemic harms. An excerpt from the NTHSSA news release from May reads, quote, "By embracing the 13 actions for change, health and social service authorities and the Department of Health and Social Services can honor the voices of Indigenous residents across the Northwest Territories and can address systemic barriers to provide equitable care," end quote. So far, there is no public information as to whether HSS and various health authorities are actually implementing these actions or studying them to start to think about what implementation will look like. It is imperative that this government fully implement the 13 actions for change. I will have questions for the Minister of Health at the appropriate time.
Thank you, member from Great Slave. Member statements. Member from the Mackenzie Delta.
Thank you, Mr. Speaker. According to NWT Bureau of Statistics, the employment rate in the NWT dropped from 66.3% in August to 65.2% in September. Based on a labor force activity report released on August 8, 2025, the annual rate of employment in the NWT dropped 2.6% since July 2024. Mr. Speaker, on the other hand, Stats NWT states that the total cases of income support rose from 1,005 in May of 2025 to 1,097 in June, a difference of 92 more cases in 1 month. With this recent drop in employment, I can only assume that the rate of income support will rise. Mr. Speaker, this is concerning to me because, as we all know, in smaller communities, income support is often abused. Without proper criteria and productivity plan, it is easy for members of community to get access to these funds and avoid working. This is often what keeps bootleggers and drug dealers in business and contributes to the housing crisis. Mr. Speaker, there needs to be more done about this process of income support because it teaches our community members that this money is free and they don't have to work. It is human right to have our basic needs met, but there needs to be a standard set for people who are able to find work instead of depending on these funds to make a living. Thank you, Mr. Speaker.
Thank you, member from Mackenzie Delta. Member statements. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, this summer, a constituent reached out to my office, and their story left a lasting impression on me. Their child, like 1 in 5 Canadians, has dyslexia, which creates challenges in learning to read. The child was not diagnosed until grade 5, however, when their family took the initiative to get them assessed in the private sector. This family was lucky enough to have insurance through their employer, which covered the assessment, But this is not the case for all NWT kids. The assessment report was forwarded to the school, who developed a learning plan, which is a good step. But Mr. Speaker, this disability should have been detected sooner. And I am concerned about how many kids in the territory with learning impediments like dyslexia are going undiagnosed. Literacy is foundational to learning, Mr. Speaker, but we have very little data on our progress on literacy in the NWT. The last time a comprehensive study of adult literacy was done was over 20 years ago in 2003. These data indicated that at the time, roughly 43% of working NWT adults performed at literacy levels 1 and 2, which are considered below the level needed to function in modern society. The NWT has not taken part in more recent global literacy surveys, such as the OECD 2024 Program for the International Assessment of Adult Competencies. Meanwhile, our last territorial literacy strategy covered the period 2008 to 2018, and to my knowledge, it has been not renewed or updated since. Other jurisdictions are well ahead of the territory on this issue, Mr. Speaker. In Alberta, in 2022, literacy and numeracy screening assessments became mandatory for students in grade 1 to 3, ensuring that students are receiving essential foundational learning in the critical early years of their education. BC and Saskatchewan are also rolling out mandatory early screening intervention and outreach in their province's schools. Mr. Speaker, the Yukon presented their renewed literacy strategy in 2023. It is the result of working group recommendations for culturally responsive teaching methods based on the latest research, and it includes early screening done in the territory's schools. Making sure our children are given every opportunity to develop their literacy skills shouldn't be an afterthought, Mr. Speaker. We need to make sure early literacy screening and assessments are done in our schools, and that schools are equipped with trained staff and proven instructional methods to ensure our students are not falling behind. Thank you, Mr. Speaker.
Thank you. Member from Frame Lake. Colleagues, I'd like to recognize the newly elected Grand Chief for the Cleat Show, former member and the 16th, 17th, 18th, and 19th Assembly. I had the pleasure of working with Mr. Jackson Lafferty in the 18th and 19th. So welcome to our Assembly. Member statements. Colleagues, on March 16, 2025, Reginald Belafontaine, also known as Reg, passed away in Halifax, Nova Scotia. Reg was a devoted husband, father, grandfather, and friend, known for his boundless generosity and his knack for turning life into an adventure. A master of laughter and magic, Reg had an extraordinary ability to bring joy to those around him, whether through his memorable treasure hunts for his children and grandchildren, his quick wit, or the countless projects he took on. Reg moved to Fort Simpson in 1996 with his wife Lois, who was a nurse at the Fort Simpson Health Center for many years. Reg was a businessman and started Rightways Coding and Energy Efficiency Technology Incorporated. Later, when he retired, he had a vision to open a bed and breakfast. Lois and Reg spent a few years renovating their home, which used to be the old RCMP barracks, and turned it into the Mackenzie Rest Inn. The inn overlooks the Mackenzie River, where guests could sit and watch planes take off, like the Red Duval Beaver, and that his son Troy Rennie used to fly for Simpson Air. They hosted guests from all around the world, and even some notable Canadians like former Prime Minister Paul Martin and singer John Landry. Reg also loved animals and established a dog pound to ensure strays and unwanted dogs could be cared for and transferred to no-kill shelters in Yellowknife cities in Alberta rather than destroying them in the community. Reg first moved to Fort Simpson. He was involved with the Lions Club, helped running community dances. This is where I got to meet him through his volunteerism. He did magic shows for children at the community events and was even asked to be Santa at the Northern Store a few times. As an unofficial greeter and ambassador, Reg would be found at the Pandaville or Nahanni Inn, welcoming visitors to the community. We'd often delight them with a magic trick or a joke. He had the ability to tell stories and keep people captivated. Reg returned home to Nova Scotia to build a home on the site for on his parents' homestead. He dedicated a lot of his time to landscaping the property, building a foundation in the front yard, and developing a pond. He was sad the day his health prevented from ever being able to return to NWT. He was a proud Acadian who became a true Northerner. Above all, Reg's love for his family. He's survived by his wife of 34 years, Lois, his sons Troy, Chris, and Josh, and his stepson, Troy Rennie. He cherished his time with his family and grandchildren, creating memories that live on for generations. His legacy of kindness, adventures, and unwavering devotion will forever be held in the hearts of his family and friends. He'll be sadly missed. Member statements. Member from Inuvik-Boot Lake.
Thank you, Mr. Speaker. Mr. Speaker, like many in here, I've spent countless hours in recreation facilities in our territory, either as a coach or a volunteer or an enthusiastic fan, Mr. Speaker. Mr. Speaker, in 1969, the Arctic Winter Games were created, in part by leadership from Commissioner Stuart Hodgson. At the time, athletes be able to participate that may not otherwise have that opportunity, Mr. Speaker. I was saddened to hear that snowshoeing will not be an Arctic Winter Games sport. Mr. Speaker, Arctic Winter Games represents a once-in-a-lifetime opportunity for kids from the regions, from smaller communities, and certainly from our capital in Yellowknife. So, Mr. Speaker, is it time that we kind of ask ourselves, is the Arctic Winter Games about medals or is it about participation, Mr. Speaker? Is it about getting everyone involved in the Arctic Winter Games? Mr. Speaker, I understand that the Physical Activity, Sport and Recreation Fund has had some challenges. Our lottery funds have been reducing. We haven't put any additional funding into it from GNWT. We have had conversations around here. My colleague, the member from Yellowknife Range Lake, Mr. Speaker, has brought forward a proposal for iGaming, where we can actually look at increasing that fund and get that funding necessary to continue to grow that sport and to make the sport available that opens up doors for kids rather than have sports based on where facilities are located, Mr. Speaker, and I think that's very important. So, Mr. Speaker, going forward, I would hope, and I will be supporting certainly the Minister, and I know the Minister is keen on this, the Minister of MACA, what's happening around Arctic Winter Games. I'm hoping to see, Mr. Speaker, regardless of what we have in our lottery fund, going forward with this year's budget, that we do properly allocate this funding. Given what's happening in our territory right now, Mr. Speaker, with addictions and with all the bad things that our youth can get involved in, it's so important that we continue to support sport, to continue to provide opportunities for people in our capital, for people in our regions, and certainly for people in our smaller communities that may not have those opportunities, Mr. Speaker. We can hold trials in the regions. We can get outside of Yellowknife as well and ensure that everybody, the intent, the spirit of Arctic Winter Games remains intact and what it should be, that kids get an opportunity to do things, a once-in-a-lifetime opportunity, Mr. Speaker, for these children to get out, to see parts of the country they haven't seen before and participate, to share their culture, their values. And, Mr. Speaker, I will be advocating, as I said, for funding for Arctic Winter Games as we move forward, and for Sport North. Thank you.
Thank you, member from Inuvik-Boot Lake. Member statements. Member statements. Returns to oral question. Returns to oral questions. Recognition of visitors in the gallery. Member from Hay River North.
Thank you, Mr. Speaker. I also wanted to recognize former member and former speaker who I worked with as Deputy Speaker and current Grand Chief of the Tlicho government, Mr. Jackson Lafferty, great partner to the GNWT, and it's been great to work with him to help advance some of these projects that the territory desperately needs. Thank you, Mr. Speaker.
Thank you. Thank you, member from Hay River North. Recognition of visitors in the gallery. Member from Hay River South.
Thank you, Mr. Speaker. I'd like to recognize my supervisor, constituency assistant from Hay River South, Myrtle Graham, who's in the gallery today. Thank you.
Thank you, member from Hay River South. Recognition of visitors in the gallery. Member from Cam Lake.
Thank you, Mr. Speaker. Mr. Speaker, I just had a meeting with a very passionate 10-year-old student advocate, Ms. Sadie Begg, who's in the gallery today from École St. Joseph School. Just wanted to thank her for her time and her passion.
Thank you, member from Cam Lake. Recognition of visitors in the gallery. Member from Range Lake.
Thank you, Mr. Speaker. I too wish to join the Premier in welcoming Grand Chief Jackson Lafferty here to the Chamber. I had the honor of serving with him in the 18th Legislative Assembly, and I consider him a very good friend. So thanks for being here today, Grand Chief.
Recognition of visitors in the gallery. Member from Moultrie.
Speaker, duhlets at inawits and kera. Goods on kitchens.
The kitchen, he's been here for the last 4 years, so thank you. I'd like to say thank you to Jackson Lafferty, who's been here for the last 4 years.
Favorite pilot, who seems to be my pilot that every time I get to fly to Yellowknife, Mr. Bowden, and I guess the better half, or the less than better half, of the member from Cam Lake. So welcome to our assembly. Recognition of visitors in the gallery. Recognition of visitors in gallery. If we missed anyone in the gallery today, welcome to your chambers. As I've said it numerous times, we'd like to thank you very much for allowing us, 19 of us, to represent the people in Northwest Territories for our 4 years. I hope you are enjoying the proceedings. It's always nice to have people in the gallery. Recognition of visitors in the gallery. Recognition of visitor gallery. Acknowledgements. Acknowledgements. Oral questions. Member from Yellowknife Centre.
Thank you, Mr. Speaker. It's a great pleasure to ask the first question. I'll be asking the Health Minister today some questions about the lab clinic that's downtown. Mr. Speaker, can the Minister explain why there are such lengthy lineups there in the walk-up portion of the clinic every single day, where in the old days there wasn't that type of backlog? What has significantly changed that things either get deferred, delayed, or denied completely? Thank you.
Thank you, member from Yellowknife Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, I don't have the exact details of the overall wait times or anything, but what I do know is that the amount of staff that's allocated through our budgeting process is full, and they have been increasing the amount, like the amounts of referrals for blood work have been increasing, and therefore there is work to be looking on, through our business process on this area as a prioritized area for access to care. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Member from Yellowknife Centre.
Thank you, Mr. Speaker. If the staff are unable to meet the demand, what's the solution? Is it hire more staff, or is it send samples of the lab techs, what they take, to Edmonton? Can the Minister reveal the solution to this particular problem? Because I've got them. I want to hear what the Minister's doing about it. Thank you.
Member from Yellowknife Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, the solution is that the demand is higher, so we are working through the business process that would look at the right amount of staff for the right amount of tests that we have to decrease the amount of tests that we have to send out. We need more lab technicians, we need more lab assistants, we need different hours. So what has happened, and just to be more clear, is the service providing a downtown clinic is the same staffing that has always been the allocation for the Stanton lab. So now they're just kind of spread out into 2 different locations, which is not working. And so I will say that this piece of the area, this area is what we've been kind of working on, so that hopefully that, in the new year we'll be able to have a better solution. Thank you, Mr. Speaker.
Minister of Health and Social Services. Final supplementary. Member from Yellowknife Centre.
Mr. Speaker, the next comment is no reflection of the staff, but it seems like the staff are unable to keep up with the pace and the demand that's there, which is sometimes reality, Mr. Speaker. And the constituents, last point I'll make, is they show up there. Unlike the DMV, they can't take a ticket. Some of them can't stand because they're elderly. They're waiting 35 people for 32 spots. It's quite a depressing experience, Mr. Speaker. So in short, Mr. Speaker, if Stanton has an addiction to deficits, as we all know, and I have a lot of experience in this, why doesn't the Minister take some bold action to go out of her way and say we're hiring new staff for these clinics and we're going to make this service equal, fair, and accessible? Thank you, Mr. Speaker.
Member from Yellowknife Centre. Minister our Health and Social Services.
Speaker, Mr. Speaker, as the member has said, that the Health Authority has a history of doing that process, but not being able to do it in a way where we need to ensure that it's done in the proper process, and that is what we are doing right now. We are ensuring that the proper process is being followed and that we are going to look at the correct amount of staff to look at what the staffing needs is for the Stanton Territorial Hospital to support. As the Stanton Territorial Hospital supports the rest of the territory, we need to make sure that when we do go forward, it's going to be the one size that's going to target everybody right across the territory. We're going to be able to run those tests that we need. We're going to be able to service the emergency departments. We're going to be able to open up those clinics so that, that the appointments are there's enough staff to do them. Thank you, Mr. Speaker.
Minister of Health and Social Services. Oral questions. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, the Northwest Territories has three major projects that it's identified as priorities: the Tulsan Hydroelectric Expansion and Submarine Line, the Arctic Security and Economic Corridor, and the Mackenzie Valley Highway. We know the Mackenzie Valley Highway is well advanced, but all these projects are very important to the future of our economy. Today, I want to ask the Premier if he views the Yellowknife Airport as a strategic asset worthy of that list. Thank you.
Member from Range Lake, Mr. Premier.
Thank you, Mr. Speaker. So I understand the question to be, is it my opinion that the Yellowknife Airport as a project is at the same, I guess, importance as the Mackenzie Valley Highway or the Slave Geological Province or the Tulsan Hydro Expansion? So I'd have to say that, the airport is very important. Obviously, I'm in there, Mr. Speaker, you're in there quite often. It gets used by people around the territory. No doubt that it is a very important asset. We look at the Mackenzie Valley Highway, that's a multi-billion-dollar asset that will be constructed over a number of years. We look at the Slave Geological Province, it's a multi-billion-dollar road that would unlock untold mineral potential. And we look at the Tulsan Hydro Expansion, and that is actually really a key part of that economic corridor. So the Yellowknife Airport, it's doing its job right now. Could it be expanded to do a better job? Absolutely. But the other projects are nation building. They are of a different scale altogether. And so while every piece of that Arctic corridor, whether it's the highway coming into the territory, the rail line up to the port in Hay River, or the Yellowknife Airport, they're all important pieces. Thank you, Mr. Speaker.
Premier, member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, the reason I brought it up is the theme of the corridor is a corridor, so not any one project, as the Premier alluded to, but also the defense aspects of it. We have DND and NORAD funding that's waiting to be unlocked. So will the Premier join the calls from Yellowknife City Hall to the Yellowknife Chamber and encourage the investment in the Yellowknife Airport as wrap it in to the Arctic Security and Economic Corridor, because it fits in with the mandate and it's a vital asset that's currently underutilized, and we're sitting on potentially tons of potential to invest in this asset. Thank you.
Member from Range Lake, Mr. Premier.
Thank you, Mr. Speaker. So we're trying to keep things simple. When we're talking about going to the feds to look for funding to build a road, that's what we're looking for. The idea of the larger idea of the corridor, which involves different modes of transportation, different pieces of infrastructure, is something that we're also alive to, and we do have discussions with the federal government about it. Myself and the Deputy Premier met with the Minister of National Defense, and we discussed a number of different pieces of infrastructure in the territory and different needs we have, including the Yellowknife Airport. I know the Minister has spoken with the Finance. The Deputy Premier has spoken with the Federal Finance Minister about this. We have multiple departments engaged in this, so this is not something that is being ignored. But that said, when we're looking for funding to build a certain project, we try to keep things to that project. So we don't want to confuse anyone. We want to be clear about what we're asking for. But there's no doubt that there are more needs in the territory than just a couple roads and hydro expansion. And we do keep that on the Fed's radar as well, and we discuss it with them at every opportunity. Thank you.
Premier. Final supplementary, member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, I would like to ask the Premier if he can direct the federal envoy to begin discussions with the federal government on a clear plan to advance the asset potential and resource needs of the Yellowknife Airport. Thank you.
Member from Rangeley, Mr. Premier.
Thank you, Mr. Speaker. We have a number of departments and ministers working on advancing the Yellowknife Airport project in terms of upgrades and looking at the future potential. And we'll continue to do that and take a whole of government approach. Thank you, Mr. Speaker.
Premier. Oral questions. Member from Yellowknife North.
Mr. Speaker, I have questions for the Minister of Health and Social Services. So it's hard to believe that in this day and age, we can't seem to create either an online system or even a phone system that works to book a primary care appointment in Yellowknife. So first question is, what is being done to ensure that people in Yellowknife can actually book a primary care appointment in a timely way for issues that cannot wait several weeks or several months to be addressed, but may not qualify as an emergency that would necessitate an emergency room visit? Thank you, Mr. Speaker.
Thank you, member from Yellowknife North, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, as this has been an ongoing discussion, I have been in contact with, especially here in Yellowknife, on an ongoing basis as to how improvements are being put into place and what can be put into place. I know that we have people can call in to improve appointment accessibility. Several other measures have been used. These include same-day access to provide appointments. There's online callback system to streamline booking requests. And from my understanding, they are getting callbacks right away in a timely manner. An active process for filling cancellation to ensure no appointment slots are lost. And together, these initiatives enhance efficiency and ensure patients can ensure appointments more easily. I do know that as I have briefings with the NTHSSA, and I do question how is the improvements happening especially within the Clewa and Gontia and the primary care clinics. And they are saying that the numbers are increasing, and their frontline staff are being trained more to, offer more appointments. As when people call in general, they used to be, I would like to book a doctor's appointment, and now they're doing more. When they are able to get through, they are able to triage them and to say, like, we can get you into a physician on your team this time, but we can get you into this healthcare provider or this healthcare provider. And that would speed up the process, which those healthcare providers work as a team. They can also consult with the physician on the patient's behalf. Thank you, Mr. Speaker.
Social Services. Member from Yellowknife North.
Thank you, Mr. Speaker. So I was a little bit unclear whether the minister was talking about improvements to come or improvements that are already in place. But the example of creating a system of same-day bookings where if a physician or locum knows they have an opening the next day, that they can contact people, for example, on a waiting list or cancellation list, and fill those slots on the same day. Is that mechanism currently in place, or is it being worked on? Thank you, Mr. Speaker.
Member from Yellowknife North, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, there is wait lists, and within the callback or the online, it is active right now. And those, from my understanding, anytime that there is a gap or an opening or in a physician or any of the health providers, it is filled with those lists that they have currently. Thank you, Mr. Speaker.
Minister of Health and Social Services. Final supplementary, member from Yellowknife North.
Thank you, Mr. Speaker. So private walk-in clinics in the NWT not only have systems where you can check your lab results online, which sometimes means you can avoid the need to book a follow-up appointment, but they have online systems for booking appointments. So it's unclear what's preventing the public primary care system from using an online system. Is this being explored or developed, or what are the barriers here? Thank you, Mr. Speaker.
From Yellowknife North, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, while private clinics in Yellowknife may use online booking, implementing a similar system in the public care system is significantly more complex. The public systems are subject to stricter regulations, including procurement rules, enhanced privacy, security requirements that do not apply to private clinics. In addition to that, the booking system must be able to coordinate appointments across multiple provider types, such as physicians, nurse practitioners, specialists, integrate with large complex health information system, in contrast with private clinics typically manage bookings for a single provider, a small team. And before introducing any new technology, it's important to fully understand the underlying challenges to ensure the solutions. And so one of the things that we are trying to look towards is the current system that we book appointments in has we cannot do anything more with it, and that's why the new system that we're looking to move towards will have all of those pieces incorporated. However, it is challenging in a smaller jurisdiction to try to incorporate that, with everything, and with all of our technology being like there's multiple different systems that also need to be fed into that one system, and not all of them are compatible. Thank you.
Health and Social Services. Oral questions. Member from Great Slave.
Thank you, Mr. Speaker. Mr. Speaker, can the minister tell me her takeaways from reading the Honoring the Voices of Indigenous Peoples report? Thank you, Mr. Speaker.
Thank you, member from Great Slave. I would assume you're asking the Minister of Health and Social Services. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, yes, I have read the report, and I actually met with Indigenous patient advocates before the report came out, and which was, we spent almost half a day together, and we talked about what they have in their job as tools, and what they're hearing from, and how can they move these things forward. And this was part of their way of moving forward some of the words of the residents of the Northwest Territories that are going through their system. And so I think it's a good report, that it highlights everything that anybody in this house that continuously says that we have challenge with this. And so now that we have it all data and tracked, and now we can actually work towards looking at how to make improvements. Thank you.
Health and Social Services. Member from Great Slave.
Thank you, Mr. Speaker. Mr. Speaker, can the health minister tell me what steps she's taking to create a robust, time-bound, and evaluative approach to implement the 13 actions for change that can be found in this report? Thank you, Mr. Speaker.
Member from Great Slave. Minister of Health and Social Services.
Thank you, Mr. Speaker. And Mr. Speaker, I think there was some timing from NTHSSA and myself. I stood in this house and did a statement on with cultural safety and anti-racism in this house. And then within the day, they were releasing this report right at the end of our session. So we weren't able to kind of combine the two. However, now we are first day back, and I followed up with the NTHSSA, and they have drafted the implementation plan. They've created that, and this plan is being reviewed by their executive. And once that is done, I can share an update with the members. Thank you, Mr. Speaker.
Health and Social Services. Final supplementary. Member from Great Slave.
Thank you, Mr. Speaker. I'm really glad to hear the minister spoke with the Indigenous patient advocates and had a good half-day session. That's really positive to hear. And that she's taken the time to review the report herself. Can the minister tell me if there are any actions in the report that she sees that are not going to be implemented, and if so, why? Thank you, Mr. Speaker.
Member from Great Slave. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, this is a report from their internal division to their executive, as they are through the authority. So this report is actually going to, once they get it to the executive of the NTHSSA, then that's where they will define on where and what their implementation plan yet. I haven't seen the implementation. I haven't seen what they're accepting and not accepting, or what they're going to continue to work on, or where they may need more information. That's usually how those types of plans come. I haven't seen it yet, so I can't speak to any of that yet. However, when I do have the information, you know, I'll be more than willing to have a conversation or share that with the member. Thank you, Mr. Speaker.
From Social Services, oral questions. Member from Moultrie.
Thank you, Mr. Speaker. Mr. Speaker, our people deserve to feel safe in their homes and not live in fear every summer.
Yes.
With that in mind, Mr. Speaker, in 2005, Klitschko Agreement was ratified and came into effect. Since that time, numerous wildfires have burned over Klitschko lands and threatened Klitschko communities. I would like to ask the minister, how many hectares of land, he may not have the answer, but I'm going to ask him, how many hectares of land have burned within the Klitschko region since 2005? Thank you.
Thank you, member from Moultrie. Thank you. Minister of ECC.
Thank you, Mr. Speaker, and thank you to the member for the question. Not data that I have off the top of my head, but I'm happy to collect that and return a response to the member. Thank you, Mr. Speaker.
Minister of ECC. Member for Moultrie.
Thank you. Mr. Speaker, readiness and preparedness are critical to fire management. However, the evacuation that occurred this summer suggests that the government's wildfire operations are still too reactive in nature. What specific steps is the government taking to improve early detection and response measures so communities are not forced to evacuate at the last minute? Thank you.
Member for Moultrie, that there is a new line of questioning, so I will move you on because that's going to a different minister. So I will put you on the list so you're back on there right away. Thank you. Oral questions. Member from Decho.
Thank you, Mr. Speaker. My questions are for the Minister of ECC. What criteria does the Department of Environment and Climate Change use to determine when a wildfire poses sufficient risk to warrant evacuation? Thank you, Mr. Speaker.
Member from Decho. Minister for ECC.
Thank you, Mr. Speaker. Mr. Speaker, within the wildfire management policy, there is a number of criteria that are looked at, and every fire that is detected, a new fire gets some form of action. So there's some of the factors that come into play are location of the fire, available resources, proximity to values, proximities to communities. So as these fires start on the landscape, the fire experts within the department take a look at the current situation. They go out, a fire assessment is done. That information is then taken and put into an initial action plan, which is used to determine whether or not that fire receives an initial response, a sustained action or response. And that really depends on, like I said, many of the factors that I recently raised. Thank you, Mr. Speaker.
Minister of Education, Environment and Climate Change. Oral questions. Member from Decho.
Thank you, Mr. Speaker. Okay, how did the department work with the Department of MACA and the community of Fort Providence to determine when to issue that community evacuation order? Thank you, Mr. Speaker.
Member from Decho, Minister of ECC.
Thank you, Mr. Speaker. Mr. Speaker, Environment and Climate Change does daily assessments of all fires, specifically ones that are threat to values or communities. Those daily assessments, that information is gathered. There's multiple joint agency meetings that take place daily where that information is relayed to all invested parties. MACA would work closely with the community in deciding when the actual evacuation event would take place. Thank you, Mr. Speaker.
Minister of ECC. Final supplementary. Member from Decho.
Thank you, Mr. Speaker. Given that information, what improvements is the department making to its wildfire detection, assessment, and response protocols to prevent delays in evacuation orders and to better protect communities from imminent wildfire threats? Thank you, Mr. Speaker.
From Detroit, Minister of ECC.
Thank you, Mr. Speaker. Mr. Speaker, after the 2023 After Action Review, there was 25 recommendations that were received by the department, all of which were accepted in principle. So some of the major points I'd like to raise here, work that's ongoing is we've increased the number of fire crews, aircraft, equipment available across the NWT. We're mobilizing crews and aircraft earlier in the season to complete training ahead of the earlier start to the wildfire season. We're conducting aerial surveys and thermal imaging to detect and address holdover fires at the beginning of the season to ensure we're ahead of those. Hiring a dedicated safety officer to ensure that the physical and mental health of our staff is top of mind. Installing backup communication networks to ensure that we have operational capability, and if we run into a similar incident like we did in 2023 when our internet cable went down. We established new qualification and certification standards for wildfire response. We're expanding the GNWT's internal capacity to deliver the incident command system. We're cross-training between structural and ECC firefighters to enhance coordination of the wildland-urban interface, and we've significantly improved our communication with community leadership and with other departments within our government and others. Thank you, Mr. Speaker.
Minister of ECC. Oral questions. Oral questions. Member from Nunavut Lake.
Thank you, Mr. Speaker. Mr. Speaker, following up on my member statement, I have questions for the Minister of MAC. As I mentioned in my member statement, Mr. Speaker, I know my colleague, the member from Range Lake, have brought it to the House many times, the issue of iGaming and the potential for revenue around that. I'd like to ask the Minister, can we get an update on the status of the work on the legislative framework around iGaming? Thank you, Mr. Speaker.
Member from Nunavut Lake. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. We're in continued talks about the iGaming topic. I think there's more to the iGaming than just iGaming. I think we have a lot of things going on with even land-based gaming type stuff. So there's a lot going on with that. We haven't reached the legislative proposal stuff yet, but there is a lot of internal workings right now on how to pursue and move this concept forward. Thank you, Mr. Speaker.
For Municipal and Community Affairs. Member from Nunavut Lake.
Thank you, Mr. Speaker. So, from what I'm hearing is we're not super close to having that work prepared yet. Something certainly we'd like to see in this assembly. Mr. Speaker, then, if the minister doesn't feel that we may get iGaming and get that revenue stream flowing, does he have a proposal, or will he be bringing forward other opportunities to ensure that we're funding the Physical Activity, Sport and Recreation Fund appropriately? Thank you, Mr. Speaker.
Member from Nunavut Lake. Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. We have a few plans bringing forward to cover that fund off. One of them is obviously submitting to the government for more funding to help support that. However, we also need to fine-tune what we're doing, looking at expenses, looking at what we're paying for in order to contribute to the actual fund itself, to make sure that the funds are actually getting to the athletes and their abilities to participate in sports and games. Thank you, Mr. Speaker.
For Municipal and Community Affairs. Final supplementary. Member from Nunavut Lake.
Thank you, Mr. Speaker, and certainly, yes. I mean, that is the goal, is to ensure that that funding gets to the athletes, particularly the athletes in the smaller communities, and I spoke in my member statement about the spirit of the Arctic Winter Games. I appreciate we have a lot of high-level athletes in this territory. They do have other venues to go through and other options if they want to pursue a career or pursue, that avenue for their sport. But participation is important, Mr. Speaker. So I know we have a seat on the International Committee, the Arctic Winter Games International Committee, with the Minister committing to ensuring that that spirit and that we are creating sports that open up doors for athletes in all our communities so they can participate and take advantage of this oftentimes once in a lifetime opportunity for those youth. Thank you.
You member from Nunavut Late, you walked the line pretty good.
Thank you, Mr. Speaker. Yeah, rest assured to the member, I've been echoing his statement quite a bit to the International Games Committee. Most recently in Alaska when I was there during a meeting, you know, I've requested, or I encourage them to look at how we do the Arctic Winter Games, participation-wise, how often the games are held. You know, these are important things to help ensure that the Arctic Winter Games are, first of all, the ability to afford them is there, but that we're able to hold them in other communities throughout the Northwest Territories. You know, it's not only us as a territorial government, it's also the International Games Committee that has to make some tough decisions. And I hope that these decisions, you know, reflect the need of getting communities and small communities to the Arctic Winter Games to participate. I myself have been very passionate about having small communities participate in the Arctic Winter Games. I know there's been some question about it, but rest assured that when I'm talking about Arctic Winter Games and participation, I do that with the communities in mind. Thank you, Mr. Speaker.
Minister of Municipal and Community Affairs. Oral questions. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, my questions are for the Minister of ECE. Mr. Speaker, what is ECE doing to ensure early literacy screening is available at the public school level in the NWT? Thank you.
Frame Lake. Minister of Education, Culture, and Employment.
Thank you very much, Mr. Speaker. So, Mr. Speaker, while Education, Culture, and Employment does not mandate specific programs of any type in NWT schools, because of our decentralized system, we certainly do work to coordinate with our education bodies as we can. So education bodies are responsible to confirm and implement programs that support the delivery of curriculum within the schools. And sometimes this might include referrals to the diagnostic assessments that do happen through the school funding framework, Mr. Speaker. There's also the flexibility to accommodate local decision making, and sometimes that includes, you know, bringing in different specialty items to work with teachers, like different specialty professional development opportunities to work with teachers so that they can really focus on the needs that they have in their classroom. But through the school funding framework, our education bodies take on the role of supporting their teachers with extra supports in classrooms. Thank you.
ECE. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, I noted in my statement that our last literacy strategy framework ended in 2018. Mr. Speaker, when is a renewed literacy strategy going to be introduced? Thank you.
Minister of Education, Culture, and Employment.
Thank you very much, Mr. Speaker. And Mr. Speaker, I heard the member's comment in his member's statement, and currently there is no intent to update the literacy strategy in the Northwest Territories that expired in 2018. We do, however, have our 2030 early learning and childcare strategy, as well as our early learning framework, which emphasizes literacy within both of those documents. Thank you.
Minister of Education, Culture, and Employment. Final supplementary. Member from Frame Lake.
Mr. Speaker, I noted in my statement that most other jurisdictions in Canada are implementing programs to ensure early literacy screening is happening in schools. Can the minister commit to following suit in the NWT and get early screening for literacy done in NWT schools? Thank you.
From Frame Lake. Minister of Education, Culture, and Employment.
Thank you very much, Mr. Speaker. So, Mr. Speaker, within our shift to an NWT adapted BC curriculum, the broader curriculum does have an assessment framework, an early literacy assessment tool that teachers can use that's built into it. So assessments will be happening and will be, the tools will be afforded to teachers to do some of those assessments in classrooms to be able to catch some of these challenges and concerns earlier on. It's important to note this is not a diagnostic assessment. And it's also important to note that there are the Well Child clinics that parents do have available to them before their child starts school. In direct response to the member's question, absolutely, within my ability in our decentralized education system, I would absolutely be happy to look at other models and commit to reviewing the screening and assessment tools that other jurisdictions are using and find out how we can potentially look at how those might work within our jurisdiction and our model. Thank you.
Minister of Education, Culture and Employment. Oral questions. Member from Yonley Centre.
All right, thank you, Mr. Speaker. I appreciate that. I want to return to the topic of walk-in clinics, and of course, this is not an extensive list of the people that work there, but there are people who take the samples, and there are people who review the samples, and that's pretty much it. But, Mr. Speaker, when people arrive at 7:30 in the morning, there's long lines. You can't make phone calls because no one answers the phone. There's no chairs, so people with mobility issues are standing there and struggling. And there's way more people there than the slots available for doing that. What can the minister do to address that type of problem with this lab clinic situation? Thank you.
Member from Yonley Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, as this is brought up in the House, I will bring this back to NTHSSA and follow up as to how things are going in the lab, in the walk-in clinic there, and if there's improvements what recommendations that, what do they, to be able to carry out some of these things. However, at this time, there's not many things that I can say on the floor of this House that I'd have to go back to NTHSSA as that falls under their authority. Thank you, Mr. Speaker.
Health and Social Services. Member from Yonley Centre.
Thank you, Mr. Speaker, and I appreciate the willingness of the minister. If she wants some simple suggestions, chairs, the little tags at the DMV. Yep, thank you, Mr. Speaker. And the problem is people show up there wanting to get their samples processed, and there aren't enough staff to actually, as I said earlier, take the samples and analyze the samples. What happens to the samples that can't be analyzed locally? Thank you.
Member from Yonley Centre. Minister of Health and Social Services.
Thank you, Mr. Speaker, and I appreciate the member, and I will take him up on if he has any other recommendations. Feel free to stop in my office and give me that list of recommendations. I'll bring them over to NTHSSA and see what they can do about that. As for the lab recs that are any lab tests that cannot be done within the House, like there is a multiple types of tests that we do in-house at Stanton, and then there are some that they just don't have the capacity to continue to do all of those samples. They send them to Alberta through the contract that we have through the lab there. Thank you, Mr. Speaker.
Service. Final supplementary. Member from Yonley Centre.
Thank you, Mr. Speaker. I'm not sure I have to walk down to the office. I've already given her the suggestions, and she's welcome, by the way. That said, Mr. Speaker, the minister did go into the other area of where the samplers are going. What type of analysis is being taken as to how much are going where, what does it cost, what does it change the process? Because I'm aware that section has requested more staffing. In other words, they put in submissions to increase the staff, but someone in the chain of hierarchy keeps denying them the needed staff, and I'm curious as to what the reasoning is behind that. So the analysis and the reasons here. Thank you, Mr. Speaker.
Thank you, member from Yonley Centre. I think that's a dual question there, double question. No, it wasn't tightening it, member. Minister of Health and Social Services.
Mr. Speaker, I will bring this back, and I know that we do track the stats, and we do know what we send out. We do actually know what it costs us to send this out. So what I can do is I can get that information and I can share it with the member. Thank you, Mr. Speaker.
Minister of Health and Social Services. Oral questions. Member from Rangelake.
Thank you, Mr. Speaker. Earlier today, the Health Minister delivered a statement about care in small communities that included 2 recommendations that have been adopted by this working group that includes bringing paramedics into the model of care for small communities. The Northwest Territories is one of, I believe, only 2 jurisdictions in Canada where paramedics are unregulated. We don't have legislation covering paramedics. So how does she intend to do this without legislation to do so? Thank you.
Member from Rangelake. Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, we have a lot of health professionals that have worked in our healthcare system, and we are slowly regulating those health professionals. We are looking, as for instance, LPNs most currently were regulated under the nursing, I think it's the CAN legislation that we passed last year. There are the Health Professions Act that we are, working on to bring to the floor, and there are a number of different aspects under that we are going to be bringing forward regulations under. We are currently trying to bring forward all of the staff that are currently regulated and throughout Canada, and there's jurisdictional scan. There's some areas that don't regulate certain things, some regulate things. So we're just trying to bring all of those forward, and I don't know where or what at this point where paramedics are, but we have had unregulated professions working in our system under policy. Thank you, Mr. Speaker.
To Minister of Health and Social Services. Member from Range Lake.
Thank you, Mr. Speaker. Mr. Speaker, the scope of practice of paramedics is unlikely to be changed without legislation to guide it. Is the department planning on bringing forward a legislative proposal or legislative changes that would bring paramedics into the Health Professions Act? Thank you.
Good question.
Member from Range Lake, Minister of Health and Social Services.
Thank you, Mr. Speaker. That would be part of this work. Thank you, Mr. Speaker.
Health and Social Services. Final supplementary. Member from Range Lake.
Thank you, Mr. Speaker. One of the reasons I'm interested is I've been speaking with paramedics, and they'd like to be regulated, and they'd like to see an act. So lest a member bring it forward to a private member's bill, which probably isn't what the minister wants to hear, when can we get assurances that there will be a bill in this House to review, to vote on, that will regulate paramedics and allow them to do the jobs that are so crucial for our communities, especially our small communities? Thank you.
Red alert.
Range Lake, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, and I think this is why we're looking at how can we implement paramedics into the small communities, because currently right now, they work in larger regional centers and not necessarily. What has happened is over the summer months, we do contract paramedics that are on standby to be able to deploy to the health centers if needed of an evacuation in a community. And so since we have them, and usually summertime is when we have our reduced services, they've been in the clinics doing triaging and helping the CHIN, working alongside the CHIN. I cannot commit to saying that there's going to be legislation. I'm looking at the legislation and the regs that we want to have to be able to work towards and implement in this government. The department is a small department to try and implement things. It's one thing to pass legislation and then it's to implement it. Then it sits there. So what I would like to do is get the current legislative list through this House before the end of this government, so that way we can have the implementation plan ready to go with them as well. Thank you, Mr. Speaker.
For Health and Social Services. Oral questions. Member from Moultrie.
Thank you, Mr. Speaker. I still had one more question for the ECC, but I do have 3 questions, 2 for MACA and 1 for ECC, so I can get it back on the list again for MACA. One is for ECC, given the increasing frequency of evacuations and climate-driven wildfire threats, what is the GNWT timeline for implementing a fully proactive wildfire management strategies that prioritize prevention over response? Thank you.
Minister of ECC.
Thank you, Mr. Speaker. Mr. Speaker, happy to stand here and say that we've already started implementing that, and that has been certainly part of the work that we have done over the last number of years as the threat and the impact of climate change, is affecting us as a territory. I think one thing that's really clear here is that we are a vast territory in landmass, but we are small in population. And the remoteness of our communities certainly is one of the very challenging barriers that we face when it comes to, being responsive to wildland fire. We have small resources stretched over a vast area. We've got a lot of programs on the go through collaboration and funding arrangements with the federal government for fire smart initiatives, with community governments, with Indigenous governments, with the population at general, and ensuring that as we move forward with our programming, that we're communicating with all of our Indigenous government partners, Indigenous organizations, and communities to maximize those resources to ensure that we are very proactive in our response to wildfire prevention in the territory. Thank you, Mr. Speaker.
ECC. Do you have another question for ECC? Member from Wolford.
For MACA. Yeah.
Thank you. Oral questions. Member from Yellowknife North.
Thank you, Mr. Speaker. I wanted to ask further questions of the Minister of Health and Social Services, this time about supports available for community health center nurses. So first is, how is either HSS or the Health Authority working to rebuild the successful model of continuous physician care that was being practiced 5 years ago, for example, in Betchakol and Fort Good Hope, where a designated physician would be on call to support the community health nurse for non-emergent matters 7 days a week? Thank you, Mr. Speaker.
Member from Yellowknife North, Minister of Health and Social Services.
Thank you, Mr. Speaker, and thank you to the member for this question. I know that right now, Fort Good Hope, the physician model is currently being under evaluation now. The pilot has been ongoing, and when I was into the community, and I even met with the physician that was the lead on that, they are hopefully to have the review completed by April 2026, and that work is actually going to be helping us to form that, when we do with our model of care for small communities. As I said, improving the model of care in our small communities is and always the priority. And so as for the on-call, I know I did raise it to ask questions because it was the first time I've heard of it. I can follow up into it more to see when it stopped, why it stopped, or those kinds of information and behind that. Thank you, Mr. Speaker.
Health and Social Services. Member from Yellowknife North.
Thank you, Mr. Speaker. So next, what options have been examined to take the pressure off community health nurses being on call after hours? For example, to have 811 or 911 or MedResponse field direct calls to what's now going to the on-call phone, instead of community health nurses being the first point of contact after hours. So this could, for example, screen whether the call is actually an emergency, and it could help protect community health nurses if there are harassing phone calls that are coming. So what options are being examined to change the way on-call after-hours calls are being fielded in small communities? Thank you, Mr. Speaker.
Yellowknife North, Minister of Health and Social Services.
Thank you, Mr. Speaker. Mr. Speaker, at this point, there is no capacity to remove the responsibility from the CHIN. However, the CHIN is still the most responsible and only provider able to handle this service within the current model of the community model of care. But there are many different things that are going on right now, including primary care reform, DACHO journey mapping, the work on small community model of care, which I spoke about in my statement today. We are improving continuity of core services delivering by both how other professions, like we just said, paramedics and LPNs, can be implemented into the system. That is one of the areas where we are thinking that could be shared amongst the different healthcare providers, because what is happening is the CHIN is the one that's usually having to see them all hours of the night, and then it closes the clinics the next day, and then they all get canceled. So if we can have the paramedics being on call at night or somebody else, recognizing that community health nurses essentially cannot be replaced, so we have to find better ways to support them. Thank you, Mr. Speaker.
Thank you, Minister of Health and Social Services. Final supplementary. Member from Yellowknife North.
Thank you, Mr. Speaker. But to get clarification there. So obviously, the community health nurse would have to be the one in a small community to offer the assistance or the care if they're the one in charge. But what I'm wondering is whether the call could go through, for example, a 911 or an 811, just as, you know, people could call 911 an emergency, and then that dispatcher would determine the nature of the emergency and then activate the appropriate emergency responder or person in charge, such as the community health nurse. But having that extra screening could field out calls that are, you know, simply harassment or calls that are not an emergency to that the community health nurse would not have to respond to anyway, but would avoid them having to be woken up in the middle of the night multiple times. Thank you, Mr. Speaker.
From Yellowknife North, Minister of Health and Social Services.
Mr. Speaker, we encourage all residents of the Northwest Territories to call 811 for non-emergent questions on their health or their family's health, and we encourage all Northwest Territories residents to call 911 first before calling, you know, the health center. Health centers are generally used when, and that was, the thing is the change management in small communities is, this has been the model for so long, and that's where they're so used to calling that they don't call 811 and they don't call 911, they call the health center. And so the health center always has a nurse on call for those emergencies as well, because when you call 811, or if you call 911 and they redirect it to MedResponse, then MedResponse will be calling the nurse anyway. So the nurse is always on call. Thank you, Mr. Speaker.
Of Health and Social Services. Oral questions. Oral questions, member for Mophie.
Thank you, Mr. Speaker. So my question is to MACA Minister. So readiness and preparedness, I'm going to say it again, readiness and preparedness are critical to wildfire management. However, the evacuations that occurred this summer suggest that the government's wildfire operations are still too reactive in nature. What specific step is the department taking to improve early detection and response measure so communities are not forced to evacuate at the last minute? Thank you.
Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. Emergencies happen anytime, anywhere, not just with wildfires. It is important that the territorial government supports local governments in being prepared for emergencies. MACA supports communities in emergency management and developing their community emergency management plans to ensure that they're prepared when an emergency strikes. If there's a flood and they need to evacuate, we need to have those preparedness documents prepared well in advance so that there isn't that instant reaction, and things are in place in order to assist a community when they're being evacuated. So this isn't a one-time thing, this is an ongoing thing. We need to make sure communities' emergency plans are up to date and that they're practiced so that when an emergency strikes, we know exactly what to do. And Municipal and Community Affairs is there to support communities every step of the way. The communities are the ones that know their communities, and MACA will be there to support them. Thank you, Mr. Speaker.
Minister of Municipal and Community Affairs. Member for Mophie.
Thank you, Mr. Speaker. With climate change, wildfire is an issue, and for many of us in small communities, and water level low is a major concern. With that in mind, Mr. Speaker, when the decisions are made that lead to a community evacuation, it seems communities and their residents are caught off guard in most cases. Is the government contemplating changes to wildfire management that allows for more proactive communications to both communities and our residents so that they are more aware of threats of wildfire and the potential for community evacuation? Thank you.
For Mophie, Minister of Municipal and Community Affairs.
Thank you, Mr. Speaker. I will speak only to the emergency evacuation line of the questioning there. And essentially, what the goal is to make sure that communities are prepared, and the resources that are provided by the GNWT to the communities in order to make sure that they're prepared to evacuate, include educated people in ICS, people trained in the management for community emergencies, and the ability to work and the ability to assess the emergencies and the hazards and make those decisions with the community, not the community telling the not the government telling the community they have to evacuate. So all agencies are working together, all levels of government, in order to make that decision, not just one government. Thank you, Mr. Speaker.
Minister of Municipal and Community Affairs. Oral questions. A member from the Deitcho.
Thank you, Mr. Speaker. My question is to the Minister of ECC. Is there a minimum or maximum distance a wildfire has to be from a community to be actioned by ECC? Thank you.
From the Deitcho, Minister of ECC.
Thank you, Mr. Speaker. Mr. Speaker, I don't have a specific distance per se to this question. There are a number of factors that would play into the pre-planning, if you will, of trigger points. So there's weather, there's wind, there's drought levels, there's moisture, Duff moisture codes. So there's a number of contributing factors that would be taken into account as they determine what those trigger points are, whether it's a recommendation for an evacuation alert or a notice or an actual evacuation. So those things will vary depending on the specific location. Like I said, the specific level of threat and the weather conditions at the time. Thank you, Mr. Speaker.
Minister of ECC. Member from Deitcho.
Thank you, Mr. Speaker. Is there a wildfire protocol or policy in place to ensure safety of residents when there's fire coming towards the community? Thank you.
Member from the Deitcho, Minister of ECC.
Thank you, Mr. Speaker. Mr. Speaker, the forest fire management policy is based on priorities, with the number one priority being human life. And certainly as fires are detected on the landscape, and I'll use 2025 as an example, we had 201 fires. Of those 201 fires, 100 received some form of direct action, and of those, 80 of those incidents were close enough to communities to pose some level of threat, with 20 of those fires being close enough to pose a higher level of threat. So certainly the first priority, based on the policy and the information that is provided to our decision makers, is to ensure that we're following that policy, and that the number one most important thing is that we're looking out for human life first, and then we look at values, etc., and it moves on from there. So yes, Mr. Speaker, that is our priority. Thank you.
Thank you, Minister of ECC. Final supplementary. Nope. Oral questions. Member from Yolney Centre.
Thank you, Mr. Speaker. My questions are directed to the Minister of Strategic Infrastructure, and I believe I'd like to focus in on specifically what I raised in terms of my member statement. Mr. Speaker, when I raised the issue that the West Kitikmeot region is pushing a project and it's on the second-tier list of the major projects list, industry, local industry, even NWT industry doesn't see themselves as part of this sort of important venture that the territory needs, that adrenaline shot in the arm, basically, to our economy. Mr. Speaker, what can the minister do to assure that our project, our side of the project, is now either included or will be added to that major list? Thank you.
Member from Yolney Centre, Minister responsible for strategic infrastructure, energy and supply chains.
Well done, Mr. Speaker. Mr. Speaker, thank you. First of all, we're not second tier, Mr. Speaker. We're on the side of the list that puts the Major Projects Office directly responsible for making sure that our project, in fact, gets moving and gets going. We've already met. Staff from Strategic Infrastructure were in Calgary to meet with the new Major Projects Office. The YKGFN and the Cleat Show are deeply involved in this project. We meet with them regularly. There's a significant plan that's been developed conjointly with those two nations on whose lands and traditional lands this project would potentially be running. In addition to which, it's whole of government, Mr. Speaker. As Premier already mentioned, we were actively meeting with counterparts in Ottawa, both myself, Minister Cleveland, Premier's office. So this is actually moving on a number of fronts, and I've also spoken with the City of Yellowknife on this, and done presentation last year and an update on this. So again, happy to have the profile raised here, and I sort of number one would say I think perhaps it's time to do another perhaps meeting publicly with the city so we can get people aware of the work that is in fact ongoing on this. Thank you.
Minister responsible for strategic infrastructure, energy and supply chain. Member from Yellowknife Centre.
Mr. Speaker, I'm a little confused on the side versus second tier. It doesn't sound like it's on the list of #1 projects, and it's not even doesn't sound clear enough that it's even on the second visiting of this particular project. Can the minister tell us what will it take to get it as a major, the Arctic Economic Security Corridor identified as a major project in this next submission? Thank you.
Thank you, member from Yellowknife Centre. Minister responsible for strategic infrastructure, energy and supply chain.
Thank you, Mr. Speaker. Mr. Speaker, there's a lot of people asking the federal government that very question. I'm not federal government. What we are recognized, the Arctic Energy Security Corridor, it was formally recognized as a project of national interest. So there was 5 projects that are in the first if you're calling it tiers, or in the first group of projects that were named as national projects. That is important for the projects that need to go through the Bill C-5 process. Being named there gives them access to the Schedule 2 or Schedule 1, which changes how they're going to go through the regulatory process. Our regulatory system is different, Mr. Speaker. I don't need to go through the process that's there. I do need the Major Projects Office to get involved, help us figure out the funding, the stacking of the funding, and the way that we're going to fund this project to get it moving. And so in that sense, Mr. Speaker, we are on this list. We are a project of strategic interest. We've got the Major Projects Office involved, and I intend to work with them to make sure that they can get us across the line. Thank you.
Responsible for strategic infrastructure, energy and supply chain. Final supplementary, member from Yellowknife Centre.
Thank you, Mr. Speaker. I won't go at length. My whole statement talked about the shot in the arm of adrenaline we need. So when can that initiative see the light of day where we'll get funding, or our proposal will be reviewed for funding on this type of initiative? Thank you.
Thank you, member from Yellowknife Centre. Minister responsible for strategic infrastructure, energy and supply chain.
Thank you, Mr. Speaker. Mr. Speaker, there's so much happening on many fronts on this, and so what I'm going to suggest is that we perhaps need to do a better job of telling our story on this project here. We were just in Ottawa. We spoke with a number of ministers while we were there with Council of Leaders. Council of Leaders are getting the word out. The Cleat Show are getting the word out. YKDFN. But again, there's a lot that's been happening. Both of those nations have gone through elections in the last few months. Those processes are done now. We're all ready to get moving, and I would certainly like to say that we will get something out publicly about how we're working together and what our next steps are. Happy to make that commitment. Thank you, Mr. Speaker.
Responsible for strategic infrastructure, energy and supply chain. Colleagues, the time is up for oral questions. Oral questions. Oral questions. Written questions. Written questions. Returns to written questions. Return to written questions. Replies to the Commissioner's address. Replies to the Commissioner's address. Petitions. Petitions. Reports on committees of the review of bills. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, your committee would like to report on its process, on its consideration of Bill 26, an act to amend the Public Service Act. Bill 26 received second reading in the Legislative Assembly on May 26, 2025, and was referred to the Standing Committee on Government Operations for review. The committee received briefings from the sponsor and stakeholders between June and September 2025. The committee also held a public meeting on September 23, 2025. The committee has also received 28 submissions from members of the public to date. The committee has not yet conducted a clause-by-clause review of the bill. Therefore, Mr. Speaker, in accordance with Rule 8.3, Sub 2 of the Rules of the Legislative Assembly of the Northwest Territories, I move, seconded by the Honourable Member for Great Slave, that the review period for Bill 26, an act to amend the Public Service Act, be extended by 120 days. Thank you, Mr. Speaker.
From Frame Lake. To the motion. Question has been called. All those in favor? Opposed? Abstentions? Motion carried. Colleagues, the Standing Committee on Government Operations has received an extension of its 120 days review period. As a result, the point of order raised by the member from Yellowknife Centre on Friday, October 17th, 2025 is now mute. However, I will refer the debate on the member's point of order to the Standing Committee on Privilege and Procedures for review and, if required, to make recommendations to the change of the rules. Reports on Committee of the Review of Bills, reports on Committee of the Review of the Bills, reports on the Standing Committee of, report of Standing and Special Committees. Member from Frame Lake.
Thank you, Mr. Speaker. Mr. Speaker, your Standing Committee on Government Operations is pleased to provide its report on the review to date of Bill 26, an act to amend the Public Service Act, and commends it to the House. And if you give me a second here, I'll prepare myself to read the report. The Standing Committee on Government Operations report on review to date of Bill 26, an act to amend the Public Service Act. Bill 26, an act to amend the Public Service Act, received second reading on May 26, 2025, and was referred to the Standing Committee on Government Operations for review. Bill 26 is a private member's bill brought forward by, Mr. Speaker, if the report names the member, is it okay to use the member's name in the House? Okay. Bill 26 is a private member's bill brought forward by Shauna Morgan, MLA for Yellowknife North. Bill 26 would make amendments to the Public Service Act to provide a process to authorize and deauthorize a separate bargaining unit for unionized nurses pursuant to a vote. This would apply to all public sector nurses registered with the College and Association of Nurses of the Northwest Territories in Nunavut, referred to as CAN in the rest of the report. The main points of Bill 26 include the following: changing the definition of employees association to include an association or other body that has been authorized to bargain collectively on behalf of nurses of the public service. Adding a definition of nurse to the Act, which includes nurses employed by the Hay River Health and Social Services Authority, which only takes effect once Section 20 of an Act to amend the Hospital Insurance and Health and Social Services Administration Act comes into force. Adding that an application may be made to the Supreme Court for an order that authorizes an applicant to bargain collectively on behalf of nurses, which may be granted provided the court is satisfied that all nurses had the opportunity to vote and that a majority of nurses who voted were in favor. Adding, through a similar process, that an application can be made after 6 months for an order to decertify the nurse's bargaining agent. Specifying that any term or condition of employment that applies to nurses as members of the Union of Northern Workers, or UNW, continues until a new agreement is entered into by a new employees association on their behalf. The Act would come into force on November 7th, 2025. This report outlines committee's engagement with the public, stakeholders, and the Government of the Northwest Territories on Bill 26. Both the sponsor of Bill 26 and the government provided substantial background information to support committee's review, which is included in the appendices to this report. Committee sought feedback on Bill 26 with a call for public submissions on the Legislative Assembly website and through social media, in addition to targeted engagement with key stakeholders. Committee received 28 written submissions on Bill 26, which can be found in Appendix C. Committee correspondence related to its review can be found in Appendix D of the report. Committee held public briefings with CAN, the UNW, Public Service Alliance of Canada, and the Northern Territories Federation of Labour. Committee also received public briefings from the sponsor of the bill, accompanied by nurses in support of the bill, and the Minister of Finance. Presentations on Bill 26 can be found in Appendix B. On September 23, 2025, a public meeting was held in Yellowknife for the public to present views on Bill 26. 17 residents attended, and 5 oral submissions were made to committee. Committee extends its gratitude to those who contributed their views during the review of Bill 26. While committee largely supports the goal of nurses having the ability to choose their own bargaining agent in recognition of their professional workplace needs and in support of healthcare sustainability in the Northwest Territories, Committee believes that the most appropriate way to address certification and decertification of any bargaining agent is through comprehensive government modernization of Section 41 of the Public Service Act, also known as Phase 2 amendments. Phase 2 amendments would allow for the creation of a labor relations board or similar mechanism to certify new bargaining agents. This approach would address the operational concerns that some nurses are seeking and would ensure freedom of association consistent with the Canadian Charter of Rights and Freedoms. Committee believes this work is crucial given the concerns raised by nurses and residents through the review of Bill 26 and the fact that the NWT is one of the last jurisdictions in Canada without a labor relations board, putting our residents at a disadvantage. During a public briefing to committee on Bill 26, the minister committed to introducing a draft bill for Phase 2 amendments to the Public Service Act in the fall of 2026. Committee is pleased to acknowledge, as evidenced through the study of Bill 26, that both the government and union stakeholders are committed to collaborative work on addressing these amendments. Bill 26 is contentious and is not a perfect bill, but committee members see value in pausing its review process for the time being and to resume its review at a later date should the government not deliver on its promise of a legislative proposal for Phase 2 amendments to the Public Service Act by spring 2026 and introduction of a bill in fall 2026. To that end, committee urges government to make accelerated progress on the Public Service Act Phase 2 amendments to ensure freedom of association consistent with the Canadian Charter of Rights and Freedoms. Recommendation 1 of the report, Mr. Speaker. The Standing Committee on Government Operations recommends that the Government of the Northwest Territories complete the engagement and work necessary to bring forward a legislative proposal no later than May 2026 session and to introduce a bill to support Phase 2 amendments to the Public Service Act no later than the October 2026 session in line with the timelines previously communicated. Recommendation 2. The Standing Committee on Government Operations requests that the Government of the Northwest Territories provide a response to the Committee's recommendations within 120 days. Conclusion. Committee has not held a clause-by-clause review of Bill 26. Committee has paused its review of the bill and may resume its review at a later date in order to hold the government accountable for progress on a bill to address Phase 2 changes to the Public Service Act. Thank you, Mr. Speaker, and I do note there is a dissenting opinion to be read.
To the report. Member from Yonge Centre.
Thank you, Mr. Speaker, and I appreciate what the chair of the committee has read in thus far. However, some of us have different points of view, and I'll share other members' points of view. Mr. Speaker, the Standing Committee on Government Operations, brackets the committee, was tasked with reviewing Bill 26, an act to amend the Public Service Act. As a member of the committee, it is important to note that while I agree with some of the concerns highlighted in committee's report on the review of, to date, Bill 26, there are several important reasons for preparing a dissenting point of view. First of all, I call it committee process concerns. I do not agree that the committee's decision to pause its review process for the time being and resuming its review at a later date should the Government of the Northwest Territories, brackets the government, not deliver on its promise of a legislative proposal for Phase 2 amendments to the Public Service Act by spring of 2026 and introduction of a bill in the fall of 2026. The first opportunity, brackets October 16, 2025, arose after 120 days study period had passed, and committee did not report Bill 26 back per the rules, practices, and traditions of the Legislative Assembly. At the time of the draft of this report, this issue was outstanding and unclear, and as all appearances, Mr. Speaker, it may have technically been worked through. At the end of the 120-day period, a study period of the bill by standing committee or special committee, all committees are faced with three options. Number one, proceed to clause-by-clause review and be reported as ready or not for further consideration by the Assembly. Number two, return to the House and request more time to study the bill, as we did today. And three, report to the House and report that the bill was found wanting and not allow the House to consider its final direction. Committee refused to formalize direction on Bill 26, which causes me concern. There is no transparency explanation similar to what is seen at the clause-by-clause stage. as to why committee formally breached the rules of the Assembly on this bill. I believe this needs to be clearly explained, including the reasons. The current direction that committee has taken constitutes a break of its own rules and proceedings without addressing the formal requirements to report progress on a bill. Committee, in my opinion, has not taken a formal position to avoid a judgment of Bill 26 and avoid a division, brackets voting, by committee, including the subsequent follow-up in the House. The refusal to proceed to clause-by-clause review, to openly ignore the Assembly's practice despite objections of some committee members, is concerning. By the time the public engagement period had closed, which tallied approximately 50 days, committee had 0 public submissions on the record for Bill 26. All written feedback from the public came after the sponsor of the bill requested more time and after some campaigners in support of Bill 26 had informed some members that they realized that no submissions had been sent in by that deadline. Concerns about Bill 26, not ready. It is my dissenting opinion is that Bill 26 should be reported as not ready and not in good form. My opinion is based on the following concerns. Direction of intent. Support for the nursing and healthcare industry continues to be unwavering. But Bill 26 has been presented as solving the nurses' challenges, but from the start, it appears to be centered around being a tool to deal with the internal labor politics. Bill 26 may mean well, but it does not address the issues raised by nurses, such as a nurse-to-patient ratio, management concerns, shift premiums, etc. Support for all health workers, Mr. Speaker. As a member of the Legislative Assembly, I have always stated that I would support a healthcare worker bill that would not exclude other nurses or healthcare workers. My position has always been no healthcare worker left behind. Teasing one group out of a larger collective group has the potential of creating upending effects and potentially setbacks that may cause serious damage to all groups, which will be lasting. Therefore, more time must be dedicated to consideration of its implications. This bill has been sold as a rosy picture in which the details will work themselves out. However, this has not proven to be the case. There are a number of inherent risks if Bill 26 moves forward, which, as highlighted during the committee review process, may prove to be a setback if not thought through, from voter rights to long-term setbacks in a new collective bargaining, etc. Many of these concerns raised at the beginning of the Bill 26 review process focused on internal matters. In other words, the Legislative Assembly is being brought to address union versus union issues. This bill was never designed to address the healthcare concerns raised by the nurses, which is based on why this group wants to break out of the Union of Northern Workers, brackets UNW. The collective of nurses has stated over a lengthy period that their issues are with management, shift premiums, workloads, and more. I know that nurses are very articulate on their issues. The sponsor of the bill is trying to give the impression that nurses are being ignored. Structural failures in the process may be there as claimed. May not be there as claimed, Mr. Speaker. Bill 26 is meant to be a catch-all. My focus continues to be on the healthcare industry. No healthcare worker left behind matters to me. There are many complementary skills, talents, and roles that work together with nurses. Why put forward a healthcare provider bargaining unit rather than a nurses unit specifically? Teasing one group out of a larger healthcare group might not be the best solution. I am concerned that the bill is causing a divide in the nursing community. If the bill moves forward, I am concerned that there will be ancillary services who will be asking for the same thing. The justification for the breakaway has been that nurses have not been heard. The UNW and sponsors say no one is listening. However, nurses have been very articulate in their position, wishes, and needs. There is no evidence to show that Bill 26 will fix the concerns such as ratios, vacancies, shift premiums, agency nurses. How it will guarantee that these issues will be addressed. The purpose of the bill claims to empower nurses, but there is no evidence that it will do that.
I have concerns with the validity of the survey done by the College and Association of Nurses of the Northwest Territories and Nunavut, (CAN), albeit well-intended. I understand that the sponsor of Bill 26 refused to meet with the UNW. I would rather see the unions sort their own house out before coming to the legislature. I am concerned it is not the appropriate vehicle at this point in time. If Bill 26 passes, government may be immediately responsible for extra costs and extensive obligations. We need to appreciate the long game rather than the short game, (brackets Bill 26). I worry about the costs that we keep creating, including if we are putting more money into boots on the ground or administration of the legislative process. Government has limited resources, and the decisions such as these becoming significant choices that we have to address in order to meet the challenges. Meanwhile, the issues of a new labor relations board is a hanging concern left unanswered. The government has committed to finding a way through this after the upcoming Public Service Act amendments have been considered. The union and government have some form of discussion to resolve these matters and have committed to working together. Further concerns, Mr. Speaker. I worry that if we pull one brick out, the rest of the system may tumble. For that reason, we need to know what is being agreed to before we agree to it. If we need to appreciate the risks and the ripple effects. The guarantee of a collective agreement freeze may exist in Bill 26, but it does not mean it will be the foundation of the next collective agreement. The potential for a lesser agreement exists. Section 6 of the bill appears to be a natural assumption that everything will be the same. Don't worry, it'll be fine. But it cannot be the same unless the employer concedes that it will be. It does not present a guarantee that the future will, what the future will look like. The content of the first collective agreement for nurses is wide open. Further, the provision's actual effect is open to the final ruling on the interpretation. Sorry. There are too many unknowns at this moment, Mr. Speaker. So, in conclusion, for the reasons noted above, I do not, as well as other members, agree with the pausing of the committee's review of this bill is the most important or effective approach. Bill 26 is flawed, therefore my dissenting opinion is that the committee should respond according and report the bill is not ready. Thank you, Mr. Speaker. And lastly, even though it's not part of the note, it did change, the tone of the report did change based on the motion just earlier. However, the substance of the principle should still stand. Thank you.
Member from Yonge Centre. Member from Framelink.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member for Great Slave, that Committee Report 25-20 Sub 1, the Standing Committee on Government Operations report on the review to date of Bill 26 and Act to amend the Public Service Act be received and adopted by the Assembly. Thank you, Mr. Speaker.
From Framelink. To the motion. Question has been called. All those in favor, please raise your hand. All those opposed, please raise your hand. All those abstaining, please raise your hand. Motion is carried. Mr. Morrison.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by the member for Great Slave, that pursuant to Rule 9.4 Sub 5 Sub A, the Government of the Northwest Territories table a comprehensive response to this report, including all recommendations, within 120 days or at the earliest opportunity subsequent to the passage of 120 days. Thank you, Mr. Speaker.
Thank you. Thank you, member. To the motion. Oh, question. Member from Yonge Centre.
Thank you, Mr. Speaker. It just seems weird that the government would be responding to something that we're just creating a delay. So it just seems odd that we'd be asking the government to respond to a report in this manner. So anyway, I just want to point that out. If they want to respond, it's up to them. We've seen the responses. They're usually pretty canned anyway, which is, it is what it is. So I just find it unusual that this motion would be in order in this particular case. Thank you.
It is a procedural thing. The motion or the recommendation is in order to the recommendation. Question has been called. All those in favor? Opposed? Abstentions? Motion is carried. Reports on standing committees, or reports of standing and special committees, reports of standing and special committee. Colleagues, in recognition of the time, I will call a brief break to give the translators a break. Thank you. colleagues. Table and documents. Table and documents. Minister of ECC.
Mr. Speaker, I wish to table the following three documents. 2025 Northwest Territories Environmental Audit Final Report, Conference of Management Authorities Species at Risk Annual Report 2024-2025, and Northwest Territories Species at Risk Committee Annual Report 2024-2025. Thank you, Mr. Speaker.
Mr. ECC. Tabling of documents. Minister responsible for Worker Safety and Compensation Commission.
Mr. Speaker, I wish to table the following document, Worker Safety Compensation Commission, Northwest Territories and Nunavut, Annual Report 2024. Thank you, Mr. Speaker.
Worker Safety and Compensation Commission. Tabling of documents. Tabling of documents. Notice of motions. Notice of motions. Motions. Notice of motion for first reading of bills. Notice of motion for first reading of bills. First reading of bills. Minister of Finance.
Mr. Speaker, I wish to present to the House Bill 32, an act to amend the Public Service Act No. 2, to be read for the first time. Thank you, Mr. Speaker.
Thank you, Minister. Pursuant to Rule 8.2, brackets 3, Bill 32 is deemed to have first reading and is ready for second reading. First reading the bills, first reading the bills. Second reading the bills, second reading the bills. Consideration Committee of the Whole of bills and other matters, Bill 21, Bill 22, Bill 28, table documents 385, brackets 20-1, or sorry, yeah, dash 20, brackets 1, table document 386-2, brackets 1, table document 387-20, brackets 1, table documents 388-20, brackets 1, with the member from the Decho in the chair.
Okay, where's the, does it go? Okay, now. I now call the Committee of the Whole to order. What is the wish of the committee? Member for Nunavut-Bootleg?
Thank you, Madam Chair. Madam Chair, the committee wishes to consider the following. Bill 21, an act to amend the Workers' Compensation Act. Bill 22, Legislation Act. Bill 28, an act to amend the Student Financial Assistance No. 2. Table document 385-20, brackets 1, 2026-2027 capital estimates. Table document 386-2, brackets 1, supplementary estimates, operations expenditures, and borrowing authorization, number 3, 2024-2025. Table document 387-20, brackets 1, supplementary estimates, infrastructure expenditures, number 2, 2025-2026. And table document 388-20, brackets 1, supplemental estimates, operations expenditures, number 2, 2025-2026. Thank you, Madam Chair.
Does the committee agree? Thank you, committee. We will proceed to the first item. All right, thank you. Consider, thank you. Committee, we have agreed to consider Bill 21, an act to amend the Workers' Compensation Act. I will ask the minister responsible for Workers' Safety and Compensation Commission to introduce the bill.
Thank you, Madam Chair. I'm here to present Bill 21, an act to amend the Workers' Compensation Act. The proposed of the bill is to modernize the pension-related provisions in the Workers' Compensation Act, aiming to create a fairer, more equitable compensation system that will bring the Northwest Territories in line with the approach used by the rest of Canada. The proposed legislative amendments replace lifetime pensions based solely on medical impairment with a wage loss benefit system that better considers a worker's job and the impact to the injury has had on their ability to continue working in that job. The Workers' Safety and Compensation Commission undertook research that led to the release of the discussion paper in 2020, which served as the basis of 2 rounds of public engagement. The feedback and the findings from this process informed the development of Bill 21. As members are aware, the Workers' Safety and Compensation Commission is shared between the governments of Nunavut and the Northwest Territories. A parallel initiative, Bill 57, received the Commissioner's assent in Nunavut, September 18th, 2025. Thank you, Madam Chair.
Thank you. Minister, would you like to bring witnesses into the chamber? Does the committee agree? Sergeant at Arms, please escort the witnesses into the chamber. Minister, please introduce your witnesses.
Thank you, Madam Chair. With me today, Rick Hunt, the WSCC President and CEO to my left, and to my right, Patrick Bruce, Legal Counsel with the Department of Justice.
I will now turn to the Chair of the Standing Committee on Government Operations, the committee that reviewed the bill, for any opening comments on Bill 21.
Thank you, Madam Chair. Sorry. Madam Chair, Bill 21, an act to amend the Workers' Compensation Act, received second reading in the Legislative Assembly on February 28, 2025, and was referred to the Standing Committee on Government Operations for review. The committee received 4 written submissions and held 1 briefing in the course of its review. The committee also exchanged information with the Standing Committee on Legislation of Nunavut's Legislative Assembly, which was studying parallel legislation at the same time. The Standing Committee completed its clause-by-clause review of the bill with the minister responsible for the Workers' Safety and Compensation Commission on September 4th, 2025. I thank the committee for their efforts in reviewing the legislation. Individual members may have additional comments. Thank you, Madam Chair.
I will now open the floor to general comments on Bill 21. The committee agreed that there are no further general comments. Mr. Hawkins. Okay. Can we proceed to a clause-by-clause review of the bill? Great. There are 27 clauses in the bill. Where possible, I will call clauses in groups of 5. Does the committee agree? Committee, we will defer the bill number and title until further consideration of the clauses. Please turn to page 1 of the bill. Clauses 1 to 5. Does the committee agree? Please turn to page 2 of the bill. Does the clauses 6 to 10, does the committee agree? Please turn to page 4 of the bill, clauses 11 to 15. Does the committee agree? Please turn to page 11 of the bill, clause 16 to 20. Does the committee agree? Please turn to page 13 of the bill, clauses 21 to 25. Does the committee agree? Please turn to page 15 of the bill, clauses 26 and 27. Does the committee agree? Returning to the bill's number and title, Bill 21, an act to amend the Workers' Compensation Act. Does the committee agree? To the bill as a whole, does the committee agree? Does the committee agree that Bill 21, an act to amend the Workers' Compensation Act, is now ready for third reading? Thank you, committee. Does the committee agree that this concludes our consideration of Bill 21, an act to amend the Workers' Compensation Act? Thank you, Minister, and thank you to your witnesses. Sergeant at Arms, please escort the witnesses from the chamber. Thank you, committee. Committee, we have agreed to consider Bill 22 Legislation Act. I will ask the Minister of Justice to introduce the bill.
Thank you, Madam Chair. I'm here today to present Bill 22 Legislation Act. The purpose of Bill 22 is to replace the Statutory Instruments Act with a more modern Legislation Act that clearly sets out the territorial regulation-making process as well as provisions related to the making of statutes. This is in line with trends across the country to replace this type of legislation with more modernized acts. The territorial approach to oversight of the regulation-making process dates from 1971 and has remained largely unchanged. The definition of statutory instrument used in the current Statutory Instrument Act is considered one of the most complex definitions in statute law and is difficult to apply. The definition of regulation in that act has also created confusion in the past. In addition to replacing the Statutory Instruments Act, the bill will replace the Public Printing Act with a Territorial Printer Act that aligns with current practices, repeal the Statute Revisions Act, and set out rules regarding the revision of enhancements and make related amendments to the Interpretation Act and Legislative Assembly and Executive Council Act. The Department of Justice engaged with other departments, the leaders of the Intergovernmental Council of the Northwest Territories, the Clerk of the Legislative Assembly, the Judiciary, and members of the Law Society. The department also consulted with 2 Indigenous governments as required under their self-government statutes. Comments were broadly supportive, and some revisions were made regarding references to the United Nations Declaration of the Rights of Indigenous Peoples and the publication of notices when editorial changes or corrections are made to legislation. I would like to thank Standing Committee for its study of the bill. I concurred with 2 motions proposed by Standing Committee. The first motion amended subclause 17 bracket 1 of the bill to require the approval of the Clerk of the Legislative Assembly for pre-publication corrections to an act. The second motion replaced paragraph 18 bracket 2 bracket A of the bill to require that the Clerk of the Legislative Assembly satisfy themselves that any copy of the act to be certified accurately reflects the act as enacted by the Legislative Assembly. This concludes my remarks, and I would be pleased to answer any questions that members may have regarding Bill 22. Thank you, Madam Chair.
Minister, would you like to bring witnesses into the chamber?
Yes, please.
Does the committee agree? Sergeant at Arms, please escort the witnesses into the chamber. Minister, please introduce your witnesses.
Thank you, Madam Chair. To my right, I have Mr. Brad Patzer, Assistant Deputy Minister, Attorney General.
I will now turn to the Chair of the Standing Committee on Government Operations, the committee that reviewed the bill, for any opening comments on Bill 22.
Thank you, Madam Chair. Madam Chair, Bill 22, let me start again here. Madam Chair, Bill 22, the Legislation Act, received second reading in the Legislative Assembly on March 12, 2025, and was referred to the Standing Committee on Government Operations for review. The committee received one written submission and held one briefing in the course of its review. The Standing Committee completed its clause-by-clause review of the bill with the Minister of Justice on September 12, 2025. The committee proposed two amendments, which were concurred with by the Minister. I thank the committee for their efforts in reviewing the legislation. Individual members may have additional comments. Thank you, Madam Chair.
I will now open the floor to general comments on Bill 22. Is the committee agree that there are no further general comments? Can we proceed to a clause-by-clause review of the bill? There are 152 clauses in the bill. Where possible, I will call clauses in groups of 10. Does the committee agree? Committee, we will defer the bill number and title until after consideration of the clauses. Please turn to page 11 of the bill, clause 1 to 10. Does the committee agree? Please turn to page 18 of the bill, clauses 11 to 20. Does the committee agree? Please turn to page 24 of the bill, clauses 21 to 30. Does the committee agree? Please turn to page 30 of the bill, clauses 31 to 40. Does the committee agree? Please turn to page 37 of the bill, clauses 41 to 50. Does the committee agree? Please turn to page 42 of the bill, clauses 51 to 60. Does the committee agree? Please turn to page 51 of the bill, clauses 61 to 70. Does the committee agree? Please turn to page 57 of the bill, clauses 71 to 80. Does the committee agree? Please turn to page 58 of the bill, clauses 81 to 90. Does the committee agree? Please turn to page 60 of the bill, clauses 91 to 100. Does the committee agree? Please turn to page 61 of the bill, clauses 101 to 110. Does the committee agree? Please turn to page 67 of the bill, clauses 111 to 120. Does the committee agree? Please turn to page 72 of the bill, clauses 121 to 130. Does the committee agree? Please turn to page 78 of the bill, clauses 131 to 140. Does the committee agree? Please turn to page 82 of the bill, clauses 141 to 150. Does the committee agree? Please turn to page 86 of the bill, clauses 151 and 152. Does the committee agree? Returning to the bill's number entitled Bill 22 Legislation Act, does the committee agree? To the bill as a whole, does the committee agree? Does the committee agree that Bill 22 Legislation Act is now ready for third reading? Thank you, committee. Does the committee agree that this concludes our consideration of Bill 22 Legislation Act? Thank you, Minister, and thank you to your witness. Surgeon at Arms, please escort the witness from the chamber. Committee, we have agreed to consider Bill 28, an act to amend the Student Financial Assistance Act number 2. I will ask the Minister of Justice to introduce the bill.
Thank you, Madam Chair. I'm here to present Bill 28, an act to amend the Student Financial Assistance Act number 2. This bill seeks to amend the Student Financial Assistance Act to increase the student loan fund, also called the revolving loan limit, in the schedule of the act from $45 million to $55 million. Enhancements to the Student Financial Assistance Program made in 23-24, along with more recent changes made to the Act by Bill 8, increase the maximum amount that may be loaned to an individual student. Bill 28 will increase the student loan fund by $10 million to ensure students who are eligible for assistance are not denied benefits due to a legislated cap on the maximum cumulative amount that can be loaned to all students. I am pleased to bring forward this bill that will ensure eligible students can continue to access assistance to achieve their education goals. That concludes my opening remarks, and I am prepared to answer any questions that members may have. Thank you, Madam Chair.
Thank you, Minister. Would you like to bring witnesses into the chamber?
Yes.
Does the committee agree? Sergeant at Arms, please escort the witnesses into the chamber. Minister, please introduce your witnesses.
Thank you, Madam Chair. Madam Chair, to my left, I have Jamie Fulford, Deputy Minister of Education, Culture and Employment, and to my right, I have Nicole Beauchamp, Assistant Deputy Minister, Labour and Income Security.
Thank you. I will now turn to the chair of the Standing Committee on Social Development, the committee that reviewed the bill, for any opening comments on Bill 28.
Okay, thank you. Okay. Thank you, Madam Chair. Madam Chair, Bill 28, an act to amend the Student Financial Assistance Act number 2, received second reading in the Legislative Assembly on May 29, 2025, and was referred to the Standing Committee on Social Development for review on September 8, 2025. The Standing Committee held a public hearing with the Minister of Justice and completed its clause-by-clause review of the bill. I thank the committee for their efforts in reviewing this legislation. Individual members may have additional comments. Thank you.
I will now open the floor to general comments on Bill 28. Is the committee agreed that there are no further general comments? We can proceed to a clause-by-clause review of the bill. Committee, we will defer the bill number and title until after consideration of the clauses. Please turn to page 1 of the bill. Clause 1, does the committee agree? Clause 2, does the committee agree? Bill 28, an act to amend the Student Financial Assistance Act number 2, does the committee agree? To the bill as a whole, does the committee agree? Does the committee agree that Bill 28, an act to amend the Student Financial Assistance Act number 2, is now ready for third reading? Thank you, committee. Does the committee agree that this concludes our consideration of Bill 28, an act to amend the Student Financial Assistance Act number 2? Thank you, Minister, and thanks to your witnesses. Sergeant at Arms, please escort the witnesses from the chamber. Committee, we have agreed to consider table document 38620 brackets 1 supplementary estimates operations expenditure and borrowing authorization number 3 2024-2025. Thank you. Minister, does the Minister of Finance wish to bring witnesses forward?
Yes, please, Madam Chair.
Does the committee agree? Thank you. Would the Sergeant at Arms please escort the witness into the chamber? Thank you. Would the minister please introduce her witnesses?
Witnesses? Thank you, Madam Chair. Madam Chair, on my left, Deputy Minister of Finance, Bill McKay, and on my right, Julie Mujsin, Comptroller General.
Thank you. Committee has agreed to forego opening comments and general comments. Does the committee agree to proceed to the detail contained in the table document? Committee, we will begin on page 3 of the Department of Health and Social Services Health and Social Programs Not Previously Authorized, $2,797,000. Does the committee agree? Supplementary Estimates Operations Expenditures Borrowing Authorization Number 3, 2024-2025. Department of Health and Social Services, out-of-territory services not previously authorized, $24,715,000. Does the committee agree? Supplementary Estimates, Operations, Expenditures, and Borrowing Authorization Number 3, 2024-2025. Department of Health and Social Services. What? Oh, sorry. sorry, I did not. I thought I heard everybody say agree. Okay. Member for. Sorry. Okay. Member for Great Slave.
Thank you, Madam Chair. Thank you, Madam Chair. For out-of-territory services in the amount of $24,715,000, can the minister speak to the over-expenditures and what is a average amount in any given year? Thank you, Madam Chair.
Minister responsible for Minister of Finance.
Thank you, Madam Chair. An average, Madam Chair, I will see if Comptroller General has that. I mean, the amount that is, yeah, let me see if the Comptroller General has that. I don't know that we have an average, Madam Chair. I mean, typically the amount that's budgeted would be, I mean, I venture to say that that may be based on an average, but again, that's not how, I don't have that kind of a number in front of me. Thank you.
Member for Great Slave.
Thank you, Madam Chair. Yeah, and I can appreciate that perhaps that's just a random ask, but I guess the point behind my question is it's not an insignificant amount of money. Obviously, our residents need to have out-of-territory services. Obviously, we budget for that. Perhaps a better question would be, does the department have substantiation or trends that they're noticing in terms of increases in this regard? Thank you, Madam Chair.
Minister of Finance.
Thank you, Madam Chair. It is indeed a difficult area. There certainly is some work being done in this respect. There's, obviously the volume of residents who may require this care is one of the areas of driver, but also the type of care that is being required, and then the costs of that care. And the cost of specialized medical care certainly in the last 5 years or so has gone up faster than what it had been previously, but also there's the costs that may be involved depending on, again, some of other parameters of just where they may be. Different facilities and services in the southern jurisdictions have different requirements for costs. So all of that I can say is being looked at right now as part of broader system sustainability and broader reviews to determine if there are areas that there could be some streamlining, including everything from the contracts with the individual providers to travel that takes place right now, both bringing residents back this way or sending families down south, how that gets approved, how it gets approved as to who needs care. So yes, I can say that that is being looked at and that some of that will hopefully come forward in the not too distant future. Thank you, Madam Chair.
Thank you. Member for Great Slave, do you have a follow-up?
Yes, I do. Thank you, Madam Chair. So for this line item, can the minister explain if this also includes the folks who are living permanently in institutions in other jurisdictions for their care? Thank you, Madam Chair.
Minister of Finance.
No, Madam Chair.
Thank you. Any further questions? Okay. Supplementary estimates operations. Oh, I didn't see her. Member for Yellowknife North, sorry.
Thank you, Madam Chair. So the expenditures that we're looking at here, the operational expenditures, are allocated to be under Department of Health and Social Services, but I understand they must be related to the services being provided by the NWT health authorities. And so we know that the budget of the health authority, at least as of March 2025, we can see the accumulated deficit of the NTHSSA at the end of fiscal year, or at the end of March 2025, was over $300 million, and it's been growing each year. Is the extra supplementary $27.5 million that we're looking at here, does that impact how the health authority deficit is recorded in any way? Or is this, yeah, maybe that, I'll just leave it there for my first question. Thank you, Madam Chair.
Thank you, Minister of Finance.
Thank you, Madam Chair. So no, Madam Chair, this is not, and there's a couple of different line items that we see in the course of reviewing the Department of Health and Social Services broadly, including where they would put money to support the authority. But this is where, if someone who has Northwest Territories health care and they go anywhere outside of the Northwest Territories, we are billed back. So this is out of territory hospital medical services. It's not residents who are permanently in other facilities or who may be residing in other facilities, sort of longer term for specialized treatment or, say, for addictions treatment, for example. This is really, it's for the medical expenses, hospital visits, physician services that would be provided. So by necessity, this is actually when services are not provided by the health authority here that we pay back. Similar to if someone who has an Alberta Healthcare or BC Healthcare card comes here, we bill them. Thank you, Madam Chair.
Thank you. Member for Yellowknife North, do you have follow-up?
Yes, thank you, Madam Chair. And so to confirm, though, I mean, I know we're looking at the second line item is out of territory services, which could include seeing physicians or medical professionals down south. And the first line item is health and social programs occurring here in the territory. Either way, would the minister agree that to a large extent the expenses that are occurred for sending people out of the territory are a direct or indirect result of choices made about services that can or cannot be provided by the health authorities in the territory? So in fact, the budgets are related. Can the minister I guess what I'm asking is, I mean, theoretically, if these budgets are considered to be totally separate, theoretically the health authority could resolve its deficit by just cutting a bunch of services here and having residents have to go down to, Alberta or another jurisdiction to access those services, but all it's really doing is shifting the cost from within the health authority budget to something that we would often have to see here in supplementary appropriations. So what mechanisms are there to actually connect the budgets and the decisions that are made for where patients can access services to ensure that we're not continually just sort of shifting problems from one pot to another and inevitably ending up here in supplementary appropriations as unplanned for costs? I know that's sort of a rambling and unclear question, but I wonder if the minister can comment on that. Thank you, Madam Chair.
Thank you. Minister of Finance.
Thank you, Madam Chair. So, yeah, Madam Chair, there's a cost associated to when someone is on medical travel, as opposed to when someone may be already down south for some other reason, or students, for instance, who are down on SFA but who are still considered Northwest Territories residents. There's a number of people who may be down south for one reason or another. And some of this may be the medical travel that I gather maybe is what Emily is getting at, but not necessarily all of it. So I can say that out-of-territory services broadly is indeed an area that the System Sustainability Unit is looking at, but it is not exclusively a matter of saying that this is all entirely medical travel related in the sense of where someone who can't get something in the north is necessarily going down south. Some of it is people who are down south for other reasons, who are choosing to go down south for other reasons, who are, as I say, students, a number of different examples. So some may be related to medical travel. I don't necessarily have that kind of a breakdown in front of me to the extent, if at all, that it is. But some is not. So, yeah, Madam Chair, yeah, anything that's out of territory, there's certainly some cost drivers, but as far as breaking that down, it's not as easy as just saying that this would eliminate all of the budgetary deficit in the authority by assuming that everyone went down south yeah, I don't know that I don't think that that blanket statement can be made. Thank you, Madam Chair.
Thank you. Member for Yellowknife North, do you have a follow-up?
Thank you, Madam Chair. Perhaps I'll just conclude by asking, do we have a target or a goal for reducing the amount of supplementary appropriations that seem to come to us every single round for, extra operational expenditures for health and social services? Has the Department of Finance set a realistic goal for when these asks are going to be reduced or eliminated, and how we might actually achieve that? Thank you, Madam Chair.
Thank you. Minister of Finance.
Thank you, Madam Chair. Madam Chair, that we are, as a government, working towards a position where right now the Health Authority does run a deficit budget. All departments and agencies do not. So we are trying to put ourselves into a position where the Health and Social Services authorities would be in the same position, namely not running any form of deficit budget. But before we do that, we are wanting to do the work that's happening both within the authority with the public administrator to determine the appropriate complement of staffing for one, but also work that's happening in the system sustainability unit to do the necessary data collection to see things like medical travel and whether or not there's some efficiency to be found. Then hopefully come out with what will be an effective number and meaningful number so that the authorities can still function and provide services that they need to. Thank you.
Thank you. Any further questions? Does the committee agree? Supplementary Estimates Operations Expenditure and Borrowing Authorization Number 3, 2024-2025. Department of Health and Social Services, total department not previously authorized, $27,512,000. Does the committee agree? Member, there is a schedule on page 4 that details borrowing authorization, and on page 6 that details the supplementary reserve impact. Are there any questions about these schedules? See no further questions, please turn to page 5, Government of the Northwest Territories Supplementary Estimates, Operations Expenditure and Borrowing Authorization Number 3, 2024-2025, Department of Finance, Revised Borrowing Authorization Total, Government Borrowing Authorization, Proposed Adjustments, $5,954,000. Does the committee agree? Thank you, committee. Do you agree that you have concluded consideration of table document 38620(1), supplementary estimates, operations, expenditures, and borrowing authorization number 3, 2024-2025? Member for Inuvik Boot Lake.
Thank you, Madam Chair. Madam Chair, I move that this committee defer further consideration of table document 386-20(1), supplementary estimates, operations, expenditures, and borrowing authorization number 3, 2024-2025 at this time. Thank you, Madam Chair.
The motion is in order. To the motion. Question has been called. All those in favor? All those opposed? The motion is carried. Consideration of table document 38620(1), supplementary estimates, operations, expenditures, and borrowing authorization number 3, 2024-2025 is deferred. Thank you, Minister, and thank you to the witness for appearing before us. Sergeant at Arms, please escort the witnesses from the chamber. Committee, we have agreed to consider table document 38720 brackets 1 supplementary estimates infrastructure expenditures number 2 2025-2026. Thank you, Minister. Does the Minister of Finance wish to bring witnesses forward?
Yes, please, Madam Chair.
Does the committee agree? Thank you. Sergeant at Arms, would you please escort the witnesses into the chamber? Thank you. Would the minister please introduce her witnesses?
Thank you, Madam Chair. Madam Chair, back again on my left is Bill McKay, the Deputy Minister of the Department of Finance. On my right, Mandy Bolstad is the Deputy Secretary to the Financial Management Board.
Committee has agreed to forego opening comments and general comments. Does the committee agree to proceed to the details contained in the table document? Committee, we will begin with page 5 with the Department of Infrastructure. Supplementary estimates, infrastructure expenditures number 2, 2025-2026. Department of Infrastructure Operations Expenditure, Energy and Strategic Initiatives, not previously authorized, $12 million. Does the committee agree? Supplementary estimates, infrastructure expenditure number 2, 2025-2026, Department of Infrastructure Operations Expenditures, total department not previously authorized, $12 million. Does the committee agree? Committee, we will now consider the Department of Education, Culture, and Employment on page 6. Supplementary estimates, infrastructure and expenditures, number 2, 2025-2026. Department of Education, Culture, and Employment, capital investment expenditures, language and culture not previously authorized, $2 million. Does the committee agree? Supplementary estimates, infrastructure expenditures, number 2, 2025-2026, Department of Education, Culture, and Employment. Capital investment expenditures, total department not previously authorized, $2 million. Does the committee agree? Committee, we will now consider the Department of Environment and Climate Change on page 7. Supplementary estimates, infrastructure and expenditures, number 2, 2025-2026, Department of Environment and Climate Change, capital investment expenditures, corporate management not previously authorized, $850,000. Does the committee agree? Supplementary estimates, infrastructure expenditures, number 2, 2025-2026, Department of Environment and Climate Change, capital and expenditures, total department not previously authorized, negative $850,000. Does the committee agree? Committee, we will now consider the Department of Finance on page 8. Supplementary estimates, infrastructure expenditures, number 2, 2025-2026, Department of Finance, capital investment expenditures, Office of the Chief Information Officer, not previously authorized, negative $273,000. Does the committee agree? Supplementary estimates, infrastructure expenditures, number 2, 2025-2026, Department of Finance, capital investment expenditures, total department not previously authorized, negative $273,000. Does the committee agree? Committee, we will now consider the Department of Industry, Tourism and Investment on page 9. Supplementary estimates infrastructure expenditures number 2, 2025-2026, Department of Industry, Tourism and Investment, capital investment expenditures, minerals and petroleum resources not previously authorized, $273,000. Does the committee agree? Supplementary estimates infrastructure expenditures number 2, 2025-2026, Department of Industry, Tourism and Investment, capital investment expenditures, total department not previously authorized, $273,000. Does the committee agree? Committee, we will now consider the Department of Infrastructure on page 10. Supplementary estimates infrastructure expenditures number 2, 2025-2026, Department of Infrastructure, capital investment expenditure, asset management not previously authorized, $11,004,000. Does the committee agree? Supplementary not previously authorized, $11,400,000. Does the committee agree? Supplementary estimates infrastructure expenditures number 2, 2025-2026, Department of Infrastructure, capital investments expenditures, energy and strategic initiatives not previously authorized, negative $12 million. Does the committee agree? Supplementary estimates infrastructure expenditures number 2, 2025-2026, Department of Infrastructure, capital investments expenditures, total department not previously authorized, negative $600,000. Does the committee agree? Members, there is a schedule on page 11 that details the impact on capital estimates. This schedule is not a votable item and is included as information only. Are there any questions on this schedule? See no further questions. As this is not a votable item, we will continue on. Committee, do you agree that you have concluded consideration of table document 38720(1) supplementary estimates infrastructure expenditures number 2, 2025-2026? Member for Bootleg.
Thank you, Madam Chair. Madam Chair, I move that this committee defer further consideration of table document 387-20(1), supplementary estimates infrastructure expenditures number 2, 2025-2026 at this time. Thank you, Madam Chair.
The motion is in order. To the motion, question. Question has been called. All those in favor? All those opposed? The motion is carried. Consideration of table document 38720(1) supplementary estimates infrastructure expenditures number 2, 2025-2026 is deferred. Thank you, Minister, and thank you to the witness for appearing before us. Committee, we have agreed to consider table document 38820(1) 20 brackets 1 supplementary estimates operation expenditures number 2 2025-2026. Does the Minister of Finance wish to bring witnesses forward?
Yes, Madam Chair.
Does the committee agree? Thank you. Would the Sergeant at Arms please escort the witness into the chamber? Thank you. Would the Minister please introduce her witnesses?
Thank you, Madam Chair. On my left, Deputy Minister of Finance, Bill McKay, and on my right, Deputy Secretary to the Financial Management Board, Mandy Bolstad.
Committee has agreed to forego opening comments and general comments. Does the committee agree to proceed to the detail contained in the table document? Committee will begin on page 3 with the Department of Education, Culture and Employment. Supplementary estimates operation expenditures. Number 2, 2025-2026, Department of Education, Culture and Employment. Not previously authorized, $15,697,000. Does the member for Yellowknife North?
Thank you, Madam Chair. So regarding the $14 million that's being allocated to address gaps relating to educational support assistance, I understand that this is an attempt to fill some of the gaps left by the removal of Jordan's Principle funding. Can the Minister confirm how much of that $14 million has already been spent up to now? Thank you, Madam Chair.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, there's been a number of requests received, but my understanding is that they're not necessarily fully allocated yet, and so I don't have a final number in terms of the allocation. There is still some funding available even with the applications that have been received, but a good portion of it has already been applied for. Thank you, Madam Chair.
Member for Yellowknife North, do you have a follow-up?
Thank you, Madam Chair. So does the Minister have a sense of what is the timeline for when education bodies that have applied for this funding, when those applications will be processed, and how soon they would get an answer and actually get money in the door to be able to hire these educational support assistants? Thank you, Madam Chair.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, there's no delay in terms of receiving or processing per se. I understand that one element of the request is that there be some amount contributed from school boards, those that had surplus funding available to them within their own budgets, and that there's some discussion happening with at least some of the school boards in this regard. So again, that's until that discussion is concluded, that's the state of some of this. Others, I think, Madam Chair, my understanding is that the funding should be already processed and already flowing, and then there's some that just in terms of making sure that the allocation of funds under this program can apply to all of the different types of programs that may be affected by Jordan's Principles, which that one may be resting with us, but I believe that that will be dealt with this week. So a few different reasons for why different school boards may not have received their funding yet. Thank you, Madam Chair.
Member for Yellowknife North.
Thank you, Madam Chair. And so the line item specifically says gaps relating to educational support assistance. Would this funding could it be applied to not just EAs, educational assistance, but also other supports needed by education bodies, for example, speech language pathologists, other sort of therapeutic supports? Can the Minister clarify what actually is eligible under this $14 million of funding? Thank you, Madam Chair.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, this particular gap filling exercise was focused on support assistance specifically. I understand there may be other work happening between Education, Culture and Employment and Health and Social Services to assist in this space. of speech pathologists, for example, but this specifically is for supporting of the support assistance. Thank you.
Thank you. Member for Yellowknife North.
Thank you, Madam Chair. So this other work that may be ongoing to address gaps left by the removal of Jordan's Principle funding around therapeutic supports like speech language pathologists, is there money planned for that? Is that located anywhere else in this supplementary budget, or is the government contemplating bringing forward another supplementary estimate in the next round? I'm glad to know that there's work underway, but I'm concerned if there is no money allocated or new money allocated, then, and if we're just sort of shuffling around existing funding for education bodies, then we might not be able to meaningfully fill those gaps for the therapeutic supports and the other kinds of things that Jordan's Principle was funding. Can the minister clarify where that funding will come from? Thank you, Madam Chair.
Thank you. Minister of Finance.
Thank you, Madam Chair. Madam Chair, when the federal government changed a program that was legislated earlier this spring, the resulting impacts to just the education system alone, not including necessarily what may have been funded under sort of a more healthcare sort of focus, but this left a gap of $58.6 million, which is one that built up over the course of several years. The school boards became more aware about Jordan's Principle and were able to develop programs to support Indigenous students. And so when the changes came down that altered the way in which school boards could, or in fact now could not apply, the gap was huge. Now there's been some modification, as I understand, coming from the federal government. This is not, I'm not in a position here in the context of the supplementary appropriation process to speak to what the federal government has modified in the intervening months following some significant advocacy by many leaders. Certainly happy, I'm sure the minister would be happy to speak to it, but so this, simply put, does not fill all of the gaps from Jordan's Principle, not by a stretch. But this is really meant to focus in on one very specific area, which is support assistance, which was an area that we were concerned was not, that needed to get dealt with as early as possible before the school year because of the concern that folks who are in these roles may well leave or be in different positions. So that is all that this is meant to cover, and it's only meant to cover the ones, again, for this coming year who were immediately affected. Some school boards have multi-year funding. They wouldn't be under this program because this is meant for those that are denied their applications by the federal government. Thank you, Madam Chair.
Member for Yellowknife North.
Thank you, Madam Chair. So I do appreciate that clarification, and we'll have to follow up in the coming days or weeks about how those gaps can be addressed. Finally, I just wanted to ask about, for us to not fully lose sight of the second item there, which is funding to support the National School Food Program Agreement. And I understand that this is offset by federal revenues. Can the minister explain whether that money then will be able to cover school, well, what exactly it covers? Are we now going to ensure that there are meals being provided in every school in the territory? Thank you, Madam Chair.
Thank you. Minister of Finance.
Thank you, Madam Chair. Madam Chair, there is, I would sort of direct, if you may, the member and others interested to the Healthy Food for Learning Foods program that is and the National School Food Program, which has a one-year action plan here for 24-25. That is now being actioned and funded through this funding, and then the funding is allocated to different education bodies at different rates, depending upon the, I presume the size, although again, I don't have the breakdown as to exactly whether it's entirely based on just pure numbers or some other qualitative assessment, but it is allocated by education body across the Northwest Territories, and what each body then does with that, again, I would point back to the school action or to the food action plan, but I can't say exactly as to what each individual education authority might be doing with their funding. Thank you.
Next, I have member for Malfui.
Okay. Thank you, Madam Chair. Well, first I want to ask the minister why Jordan Principle application were denied in Yellowknife? If they have, yeah, I want to ask why. If they know why it was denied.
Thank you, Minister of Finance.
Thank you, Madam Chair. Madam Chair, I mean, if I might be so bold as to say, I don't know why any Jordan's Principal funding application that was coming from a school professional who would have presumably understood and known the needs of the children that are in their care for the full day would be denied on behalf of the Indigenous children in the Northwest Territories. Our government did not make that decision. The federal government made that decision. That said, they are working, I believe, towards finding a path that will modify some of the changes that were made back in the spring. I can't speak for the federal government. They have their own budget coming out in less than a month. Hopefully in that budget we will see some changes therein. This has been an issue raised by a number of leaders ourselves at the Council of Leaders table, pointing out that the political organization of the North is different and that the way that the Jordan's Principal funding was coming through needs to be recognized for that. And again, hoping that we will see some modification in their approach. Thank you.
Thank you. Member from Mafway.
Thank you. Okay, because I know this 14 million came about because majority of the people or majority of the position affected Yellowknife School. You know, like I think we were talking about like 75 positions that were affected. And I have an issue with that, you know. If we don't know why 14 million or why JP application were denied, especially in Yellowknife, was never a major issue for us in small communities because we know the majority of the are Indigenous, so it's being utilized well. So why are we spending $14 million? So where is this 14 million going to come from? Thank you.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, this came forward through the Department of Education, Culture and Employment to support the fact that Indigenous children in schools across the Northwest Territories were going to be very directly impacted. 205 positions from across the Northwest Territories were being immediately affected with this first year of denials coming from the federal government. And there was certainly a large number of students affected here in the North, here in Yellowknife, because there's a great deal of Indigenous students here in Yellowknife. We have 50% of the population, so while it may not be a majority Indigenous community, there's a lot of Indigenous students here, the highest number of any capital city anywhere in Canada. Beyond that, the Beaufort Delta was the second highest number that were being immediately affected because those school boards did not have multi-year funding or their funding programs had expired this year. But those that didn't experience these changes this year were certainly going to be facing that next year. So this is a gap-filling exercise for the moment. Again, we're looking to the federal government to reconsider how they can get back to the core principles of Jordan's Principle, which is to ensure that Indigenous students, wherever they may be, whether it's in a capital city or otherwise, all have access to the kinds of programs and services that we know that they need. Madam Chair, I'm certainly happy to get a breakdown, but I don't know to what extent the boards want that to be necessarily a public number, so I'll just want to make sure that I'm not sharing information on behalf of school boards that they don't want me to, but I can certainly get it to MLAs. Thank you.
Thank you. Member from Mafway.
Thank you. Okay, well, we know that majority of the positions are going to be allocated in Yellowknife. So we know that, so I just want to ask another one too, is that, is this going to be one-time funding or is the government going to permanently fund this? Thank you.
Minister of Finance.
Thank you, Madam Chair. Right now, this is a one-time funding situation, and I realize I failed to ask one of the other questions on the last round as to where it's coming from. This is being debt funded. We are not in a position where we have excess money in the education system. We are looking for, and we've made that very clear to the federal government. So there already has been, I understand, some changes and some modifications where they will accept individual applications that come through a school board. But again, this is their program, and I'm hesitant to say what changes they have made or will make. But really, Madam Chair, the focus here is on Indigenous Northern students. these are the students that are losing the funding. Again, 25,000 people live in the city of Yellowknife, and I think approximately 30% of them are Indigenous Northerners. So to the extent that those children are affected first, they are affected first. The Beaufort Delta is second in line right now, though. They have a large number of children that were affected. And it really, this is a gap filler, but it's really a line of sight on the federal government to say we cannot continue to support this. It was a legislated program, and it was put in place because we all recognize, I believe, that Indigenous children have been historically and systemically not given the same opportunities that non-Indigenous children have. So again, I'll stop there, Madam Chair. Again, my frustration on this one is that despite a lot of requests, that we are still waiting to see what the federal government might do. Again, hopeful that we will see some changes that make this not a program that the GNWT has to take on. Thank you.
Thank you. Member for Mafui.
I see it says here, service gap relating to educational support assistance. Why only this? Why not on speech and language, OT, etc., to help improve the outcome of our students, the education outcome for our students, especially those starting at elementary, JK? The overall picture here should have been focusing on improving the education outcome. In small communities, we have on average less than 50% graduation rate compared to over 80% in Yellowknife. The outcome for YK is better than small communities, and we know it has always been like that with funding allocations. The federal government gives the money to the territorial government, and once it gets distributed to the small communities, we get a small portion. It's always been like that. We've always been at disadvantage. And I am, kind of disappointed because now this 14 million came about to support larger regional center. If this was already happened in small communities, I don't think we would get that attention. If Yellowknife graduation rate was low, it would get national attention. And what do we get? We get nothing. Here were our young people leaving high school. All of them, majority of them entered high school or college going upgrading. There's, OCAP and UCAP through Aurora College. And it doesn't look good. It doesn't look good. It's just that it should have been the focus right from beginning when they're allocating money. We shouldn't have to fight for this money, but we are, and it's a disappointing. I am disappointed with that because I think the results, the education outcomes should have been the focus, central focus. There's no way that, it's hard for us. It's going to be hard for us now because we lack a lot of services. It's going to be hard for us, for our young people who are the future generation, to catch up. Now I heard from one of my constituents who used to live in Yellowknife. She had to relocate to larger center down south, just so that, because Yellowknife failed to meet her need through JP program. Now she's going further south with her child. And small community, they go to Yellowknife because the services are better. Now, it's the other way around, that a lot of our young people, our families, or the families are going south for better services. So it's just that I think if they're if they're going to be doing this, they should have been doing more for small communities. More emphasis should have been given for more program and services at the school level, because our young people are always going to be at disadvantage. Small communities are always going to be at disadvantage. It's just. I don't agree with it. I don't like it because it's putting a lot of our young people at risk, and we're putting their life on hold. And it's just, it's a disaster. For me, it is. It's just not right what we're doing here, just because the 14 million, the larger part, it affects Yellowknife. That's why. So I don't really agree with this, or it just doesn't sit well with me. Thank you.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, the item that came forward from Education, Culture, Employment in response to the federal government's decision to take away money from Indigenous students did not apply to Yellowknife exclusively, does not apply to any individual community or education body exclusively. It is for school boards who are being denied their funding that they were receiving through Jordan's Principle. If a school board is being denied funding anywhere in the Northwest Territories, they can apply to this fund. It so happens that there are two largest school boards in Yellowknife. One of them is not eligible because they are not right now under, they are under a multi-year program, and so they are not applying. One of them was under a single-year program, and they are applying. But as I said, Beaufort Delta is another one of the larger centers that is seeing themselves, finding themselves first affected by the federal government's program cut changes. But Madam Chair, I don't want to spend a lot of time on this. I see the time on the clock is gone. I can't say enough that even in Yellowknife, the numbers came out earlier this spring with respect to graduation rates and success rates of students. Indigenous students in Yellowknife do not perform as well as the non-Indigenous students, and they deserve to have every opportunity as well. Thank you, Madam Chair.
Thank you. Next, I have member for Rains Lake.
Oh, thank you, Madam Chair. I thought I heard Great Slave, but thank you very much for the opportunity to ask questions. So I too want to query the minister about this subsidy program for the service gap related Jordan Principle funding. Jordan's Principle funding is fundamental to our schools in the Northwest Territories. That's how it's been described by both, I think, the minister at the table and the Minister of Education, the Minister of Health, to the point where it is being referred to as foundational. So I think that creates a challenge because, one, I get the advocacy to the federal government saying this is not optional. You need to step up and continue to deliver the service that you've been providing to support our schools. But if they do withdraw it, then it puts us in a difficult situation if we're maintaining it's foundational to our education system, but we can't afford it. So I think we're going to have to take a broader look depending on how these changes go. So the first thing I want to ask is just a comment the minister made, and I don't have the benefit of Hansard, but it was along the lines of there may be some JP funding change discussion that might be had, but not here on this item, but to the Minister of Education. I just want to clarify, is that just if we want to ask questions about Jordan's Principle be better suited for the Minister of Education, or is there new information to share that we can expect in the coming days? Thank you, Madam Chair.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, I mean, I appreciate the question. I do think that's an important question to ask. It's probably a question to ask to the federal minister. So I mean, we were just there, all of Cabinet, Council of Leaders, met with Minister Golmasti, met with Minister Chartrand, and, the indications seem to be that they've heard us, because it's certainly not by any stretch the first time that they've heard any one of a number of ministers saying, this was a legislated program that the federal government brought about. No indication that when the program review, for probably not unreasonable grounds, was going to come forward, as it, there's certainly stories or anecdotes that seem to suggest the program wasn't being always effectively used, but there's lots of opportunity to show where it was being well used. So we've seemed to be getting the sense, I would venture to say, from our federal counterparts, we've heard you, we understand that the North is different, we want to respond to the North being different, but as for what that's going to look like, it's gone a little bit quiet, and I suspect it's because they have a budget coming out November 4th. So maybe someone will hear more in the coming days. It would likely go first to our education minister if it does, but at this moment in time, I don't think I have anything more on that one. Thank you.
Thank you. Member for Rains Lake.
Thank you, Madam Chair. Well, I appreciate that answer. I would love to ask those questions to the federal ministers directly. So I'll take that as an invitation to join the minister on the next trip to Ottawa. I think that's what I heard, but I'll follow up with her.
They don't bring members.
Maybe they will this time. Okay. So, the total, we just heard the total amount for JP funding last year was 58.6 million. So do we have a calculation for if we remove the multi-year funding that is not being lost, so for school districts like Yellowknife Catholic schools that have multi-year arrangements that aren't lapsing, do we know what that looks like? Like, what was the anticipated amount of Jordan's principal funding that we are covering, or that is created the gap? What is the total quantum, financial quantum of the gap? Thank you, Madam Chair.
Thank you, Minister of Finance.
Thank you, Madam Chair. I don't have that. The 58.6 million number that I had put forward is based on the current fiscal year and really for education authorities only. And when adding in 25, 26, but then also considering that there would have been some elements, for example, if there's diagnostic services or treatment services or healthcare related services, I don't have that number. So the number certainly does start to grow when we add all of that in. I can see if we can put that together. It may be that it is, I don't have it in front of me right now. Thank you.
Thank you, Member for Rangeley.
Thank you, Madam Chair. I appreciate, just to be clear, I'm going to continue to ask questions, but I appreciate this emergency funding, and I support it. I think it came a little late, and it's still, until we know what that total quantum is, it's unclear whether 14 million is a significant amount. So my other question related to this is, there's strings attached to this money. The minister spoke to some of the eligibility requirements, but one of them is that education bodies have to first use their surpluses. So do we know how much surplus money is being spent alongside this 14 million? So how much surplus from the education bodies is being spent alongside the 14 million? Thank you.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, so that would depend, I think, on the individual education bodies. I was, let me see if, it's certainly, there's an understanding of, my understanding, is that there is work being done with each applicant to determine, firstly, if they have some surplus funding available to them, but then also what their own expenditure plans may be. And certainly not wanting to, it's certainly by no means a matching criteria, like a one-for-one, but I don't know that there's a specific, or there is not a specific number that I can provide. Thank you.
Member for Rangeley.
Thank you. And I know it's not matching, but the criteria is very much dependent on you use your surplus before you get to these numbers, and that has caused consternation from some school education bodies who have expressed concern about this. And I want to stress that education bodies are not in a position to criticize programs. Every time I've met with them, regardless of where they're at in the territory or which region they serve, it is very clear that this is they have a lot of needs, and students with a lot of needs, and are chronically underfunded. So anytime funding comes along, they're not going to say bad things about it, but they may offer criticism. And in a CBC article on September 22nd, the South Slave Divisional Education Council spoke to this surplus requirement as, quote, this would set us up for failure. The YK1 said, quote, I basically applied on a hope and a prayer to see if we'd be eligible for anything. So those kind of statements, in contrast to this, do cause me concern, because that does not sound like there's a clear pathway for the eligibility requirements. So do we know how this money is going to break down by regions? I mean, my colleague from Monthwy asked some pretty pointed questions about this too, about where money is going. So let's just, how are we going to account for this? I'm assuming we'll see it in the public accounts in some form, but are we going to see it in the education bodies? Are they going to be reporting on it? How can we get a wrap up to make sure that this is maximizing impact? And some of these unanswered questions about how many surplus dollars are coming forward, which students are being affected, everything we basically said today, how can we see that at the end of the day? Because right now, I don't think this is as transparent as it ought to be. And again, I will join the chorus of everyone here, I think, saying this is a responsibility of the federal government, and it was a very bad decision for the North to do what they did. But right now we're talking about this program and how we're using it to maximize the benefits to Northern students. So if the minister can tackle some of those issues. Thank you.
Minister of Finance.
Thank you, Madam Chair. So I'll say at the outset, I am trying to avoid saying exactly the number that the boards don't want to spend. I don't necessarily have their blessing to say those numbers that are on the floor for them or that are before them for decisions. So what I can say is this, that right now what was requested in order to participate in this program, which again is us stepping in for the federal government when we're really ill-funded to do so. So I hear the frustration and I appreciate the frustration from the boards, but we weren't expecting to be filling rather the significant gap on just a few months' notice when we were already through our money estimates process. But what's required is really firstly the confirmation that an application to the federal government's been denied. Secondly, a specific number that's being requested, so how many positions are being requested. Including where they were at in terms of a salary level. And then last but not least is this issue of a confirmation that if there is some surplus available to the board, that there's some amount from that that's being allocated based on the number of support positions that they're looking to use. So that's where when I'm saying there's not a specific formula or number, it's because it's dependent upon how much of a surplus a particular board has, how many positions they're looking to fund, and also ensuring that any request to use that surplus wouldn't impact expenditure projects. So particularly if the surplus is being used, for example, to replace a roof or do something else, wanting to avoid dipping into that. So that's the system now. I'll stop there for the clock. Thank you, Madam Chair.
Thank you. Member for Ainslie.
Oh, thank you. I just think we need to have some very clear reporting on it. Just so we understand it, but maybe that is a question for the education minister. Finally, I guess if we could put it into terms, we often ask this, like how much money is represented when it's being spent on staffing in particular or programs, how much does it actually represent? So out of 14 million, how many EAs is that employing or EA positions is that creating? Thank you.
Minister of Finance.
Thank you, Madam Chair. I mean, it would be sort of upwards of 170 is the best estimate I can have right now. I mean, and again, that would depend on the final applications, but the projection of the 14 million is that it should cover 172 based on average costs. But again, my hesitancy just being depending on whether or not school boards are able to help support this gap filling exercise, that may fund more positions. Thank you.
Thank you. Next I have member for YK Centre.
Thank you, Madam Chair. I think most of my questions largely been answered by my colleagues here, but I'll just clarify just one point because it sounded like it was folding into the question and folding out of the question, which is even though this is educational assistant money, is some of it intended for Jordan's principal money in that? Thank you.
Minister of Finance.
Thank you, Madam Chair. To the extent that Jordan's principal system was being previously used to support the education assistance, then yes. Thank you.
Thank you, Minister, member for YK Centre.
Thank you for that. Will it come with the same types of restrictions? Jordan principal money was intended for Indigenous students, so if they were offering, say, PT or speech, language, etc., for students in a context of ensuring that no child is, say, being held back adversely, of course, they were informed that they couldn't use the programming for other kids of need. Does that type of same restrictions come forward if there's no negative ill effects of the time of the available professional? Thank you.
Thank you, Minister of Finance.
Thank you, Madam Chair. So again, one of the requirements was to provide the application that went to the federal government for Jordan's principal. So, again, that is bound up within the application process here. Thank you, Madam Chair.
Thank you, member for Yellowknife Centre.
Yeah, thank you. I apologize. I only heard half the answer there. What I'd like to say is maybe if I restated the question differently, maybe I'll get the same answer and that'll be fine too, which is the essentially, are they able to bleed coverage, in other words, take more kids on that are non-Indigenous in this regard. So in other words, if a PT specialist, through the Jordan's Principle money that we're covering to the extent of what you've defined, has openings, are they allowed to offer it? Because previously they weren't allowed to extend the services, and that was ensuring enough kids get support. And again, I'm underscoring heavily that it's not an intention of trying to scoop anyone's opportunities. I'm saying, can they use utilize some of those services whilst they're there? Thank you.
Minister of Finance.
Thank you, Madam Chair. So again, Madam Chair, the application process is one that goes through the same as it would have been for Jordan's Principle, which is that it needs to demonstrate that the students are, or that the application is one focused on Indigenous students. I mean, the reality is more resources in a school are more resources in a school, but to the extent that there's going to be students or education assistants assigned more directly to Indigenous students, then right now, if there's one teacher with no education assistants in a classroom, if there's a majority of Indigenous students there, or one education assistant, they may now have more that can then focus exclusively on our Indigenous students, and that would theoretically free up the others. But I hope that kind of gets at what the member's asking. Thank you.
Member for White Cay Centre.
Yeah, I'm hoping the minister appreciates this. Most of these questions aren't really for her in the sense, I mean, these are application questions that go down the line. I'm just thinking of reasonable use and good management of resources, and certainly not taking away from the intent and the spirit of them. So, is the minister familiar with that, how many educational assistants will be able to come back, given the fact that this particular money has been somewhat reinstated? Thank you.
Minister of Finance.
Thank you, Madam Chair. Unfortunately, I can't say with certainty. I mean, obviously, the first step is for the boards to confirm the acceptance of a contribution agreement for the funding, which, as was noted earlier, there are still some boards that are in discussions with EC&E as to whether or what amount of a surplus would be appropriate for them to provide in support of this program. So until that is concluded, I won't have a number as to how many are in fact successful in being hired or rehired. Thank you.
Member for White Cay Centre.
Thank you for that. All surpluses aren't created equal. So have you targeted or defined what type of surplus? You could have like a capital surplus, an operational surplus, a surplus was for this program, a surplus for that program. I mean, is the expectation that they raid the coffee surplus fund? Is it every single surplus, or has it been defined? Thank you.
Minister of Finance.
Thank you, Madam Chair. So, Madam Chair, I'm not sure if I have that level of the operational details of this plan here in front of me. I'll just simply I believe this would be really an operational sort of level discussion and perhaps even really down into the departments. It was, again, I acknowledge that certainly not every surplus is necessarily created equal. School bodies do get their funding via the school funding framework and formula, and that does give them some flexibility to maintain their surplus so that they can, obviously, within appropriate parameters. But even those surpluses themselves are subject to some restrictions. So, again, my understanding on this front, and to be clear, is that what is being asked of them is not to impact on infrastructure plans, capital plans, or any existing operational matters to which the funding was already planned or dedicated. It was really where, if something was sort of being held as a rainy day fund, that would be, for instance, would be where there'd be a request to support the program through the use of those rainy day funds, being as that this is really a rather rainy day when we are losing this funding. Thank you.
Member for Yellowknife Centre.
Yeah, my concern, of course, is good management and stewardship of public dollars, even at the school board level, which is certainly an important level. Encouraging good management that creates surpluses for the rainy day seems almost like why bother at this point if we know that they're just going to come take it and tell us to spend it otherwise. So it almost seems like a disenfranchised principle for those who've managed well and those who've spent. And so If you spent, you get rewarded with more money, and if you saved and trimmed and nipped, well, we're just going to take it away from you anyway. So it feels that way. Just to clarify, how many EA positions are represented by the, and I quote, the service gap, if you could help with that. Thank you.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, every dollar that we are speaking about, whether it's potentially the 14 million that we're requesting here now, or every dollar that flows through education, culture, and employment to the boards, are public funds that are appropriated here for the purposes of delivering education. So I certainly would suggest that to the extent that a school board has some additional capacity, when there's a rainy day, this may itself be the rainy day. So they would then potentially have more ability to draw a larger number of education assistants under the current situation we all find ourselves in. Now, as for grand total, as I say, the 14 million was estimated to cover roughly 172 different positions. I believe there's well over 200, upwards of 200 positions, if I recall correctly. If I'm incorrect about that, Madam Chair, I will certainly correct myself. 205 actually is the number I'm getting that were affected just for the EA positions. Thank you, Madam Chair.
Thank you, member for Yellowknife Centre.
Can the department provide the breakdown of where those EA positions were lost or prescribed to in the context of where the $14 million is supporting the 172, hopefully to return? And lastly, is there any accounting for that? When you do that exercise, can you also inform us on the accounting of how many have actually returned? And I'll wrap this up, Madam Chair, because time's running out, and I guess my questions are too. But the point being is, in this money, we wish it could have been. We wish the conversation could have started in June, and even if in this particular case it may have made sense to inform us and said, hey, we have to proceed by special warrant to protect these jobs, and we will account for it in a wholesome form in the fall as we are today. And the reason I say that is because my fear was at the time is when we're told we're going to lose all these positions, the sky is falling, and how long can you sit there if you've got a mortgage, you've got child payments, you've got kids who want dentists, and goodness, they may even want Christmas presents in the fall or birthday presents and all those things. You've got to make life plans, in other words, and you can't just sit and hope that somebody will come in. Today is October 20th. If you're an educational assistant waiting for the last week of August to roll around to confirm if you've had your job, I'm just going to round numbers and say you're probably close to 7 weeks late on being employed, unless someone. So I think really what I'm trying to score is I'd be surprised if most of them waited. If they found jobs in the GNWT, the federal government, other provinces, in other words, left or private industry, I mean, it'll be pretty tough for some of them to come back. So if there's any way to do an accounting on out of the 172 that were initially lost, how many have returned, that would be really a great appreciation from a context of understanding the impact this has had. That could also lend to your argument moving forward, how that's helped negatively impress upon our economy. Thank you.
Minister of Finance.
Thank you, Madam Chair. Madam Chair, so there was certainly some initial efforts made by Education, Culture and Employment to gather details from education bodies as to what their needs would potentially be with the loss of their individual Jordan's Principal application funding, obviously each one having their own specific applications in and outstanding, and some were still being approved and some were not. So efforts to that regard began in June, and then this matter came first to the Financial Management Board and then comes at the first opportunity for a session, which is here. Again, certainly happy to try to parse out some of that, those numbers for the member. Again, just same note I made earlier, I would want to confirm through EC&E that we are sharing information that is about the board's structures and not doing that in a way that would in any way cause them any consternation. But subject to that, we can share that information. Thank you.
Thank you. Next, I have member for Inuvik Bootleg.
Thank you, Madam Chair. Madam Chair, I move the chair rise and report progress. Thank you.
There is a motion on the floor to report progress. The motion is in order and non-debatable. All those in favor? All those opposed? Motion's carried. I will now rise and report progress.
Reports of the Committee of the Whole. Member from the Deitcho.
Mr. Speaker, your committee has been considering Bill 21, Bill 22, Bill 28, and table documents. Mr. Speaker, your committee has been considering Bill 21, Bill 22, Bill 28, table document 386, 20 brackets 1, table document 387, 20 brackets 1, and table document 388, 20 brackets 1, and would like to report progress with 2 motions carried, and that bills 21, 22, and 28 are ready for 3rd reading. And Mr. Speaker, I move that the report of the Committee of the Whole be concurred with.
Member from the Deitcho. Can I have a seconder? Let's just pick on a lady from Nuvik Twin Lakes. I mean, a lady from the minister or the member from Nuvik Twin Lakes. There we go. Got it right. The one that's turning red over there. All those in favor? All those opposed? All those abstaining? Motion is carried unanimously. It's going to still be the same result. Reports of the Committee of the Whole. Reports of the Committee of the Whole. 3rd reading of bills. 3rd reading of bills. Orders of the day, Mr. Clerk.
Thank you, Mr. Speaker. Orders of the day for Tuesday, October 21st, 2025 at 1:30 p.m. Prayer or reflection, minister statements, member statements, recognition of visitors in the gallery, reports of committees on the review of bills, reports on standing and special committees, returns to oral questions, acknowledgements, oral questions, written questions, returns to written questions, replies to the Commissioner's address, petitions, tabling of documents, notice of motions, motions, notice of motion of first reading of bills, first reading of bills, second reading of bills, bills 32, consideration in Committee of the Whole of bills and other matters, table document 385-20 bracket 1, table document 386-20 bracket 1, table document 387-20 bracket 1, table document 388-20 bracket 1, report of Committee of the Whole, 3rd reading of bills, bills 21, bill 22, bill 28, orders of the day. Thank you, Mr. Speaker.
Thank you, Mr. Clerk. This House stands adjourned until Tuesday, October 21st, 2025 at 1:30 p.m.